Hi, good morning, all of you. Good morning again. Thank you for joining us today for this exciting and knowledgeable session as far as um, Ayurveda and technology is concerned. So, first time on our platform, that is IndianVedyas.com. I, Dr. Piyush Juneja, founder of IndianVedyas.com. We are doing this session on Ayurveda patient management software. In fact, I will not say patient management software. I would say entire clinic, entire your practice will be managed through this technology, through these various softwares and platforms which are available. So I request all of you to let's start this session today. Let's have a focus. We have esteemed speakers with us from across the world, and we are very thankful to them for joining us today on this lovely Saturday morning, on this weekend. In fact, uh, we are seeing that entire world is watching right now US as far as the US elections are concerned, and we have a couple of uh, I can say speakers straight from US. So let's start our session, and we are getting actually we have audience from US, and we are getting this comment that this is not the right time. Maybe this is a bit late there. So I like to inform all of you, our international participants, and we first of all thankful to all of you. We get so many international participations from US, from East Coast, West Coast, and Canada and European countries. Australia is a good time. They have already started, Australia and New Zealand. So you can watch the recording. We have the entire recording. We will have the entire recording on our social media platforms. So you can watch that later on. No issue. You can have a nice sleep. I agree that this is not the right time for all of you to watch live this session in back in US. So don't worry. This recording will be there. So let me just start quickly before I will I will request our esteemed speakers to join us for the discussion. So the requirement and the why we are doing that. So first question is why we are doing this, why we are doing this session. So the requirement and the context is we started getting so many queries that now this is an era of digitalization. We all have learned due to this pandemic that yes, online consultations, technologies, digitalization is very important. We were aware prior to the pandemic, prior to the COVID also, but now a sudden shift, or I will say drift, is there in many clinicians, and we are getting this feedback from many doctors, in fact including our practice also. Most of the doctors are shifting or maybe seeing this pattern that many of their patients are more comfortable in getting online consultations. We have started this few years back, and now we are also seeing that is one point. Second, as soon as you start or you tend to grow, the data which you are doing and the data you are managing is very challenging, in a very challenging state if you are not doing with the software. Third, the entire world is looking forward for an evidence based Ayurveda. There are so many question marks, and we have to prove now, although with due respect to our system it is already proven, but still evidences are required for each and every indication. And these kind of softwares and these kind of tools and technologies help us to create that evidence based Ayurveda, to create that database, to create that big data which we are looking forward. So I request all of you to let's listen from our esteemed speakers. And there are so many other issues like inventory management. Most of the Ayurveda doctors and Ayurveda centers and clinics are dispensing the medicines, and they are managing the inventory on their own. So how they will be managing that with the software? There are GST compliance. Can we do the invoicing? Can we do the accounts management through this software or not? So there are so many questions in fact coming up in all our minds, and we'll be asking to our esteemed speakers today. So let's hear from them. Each one of them will be coming up with their own aspect first. I request to all the speakers, let's have a brief quick 10 to 15 minutes of session from each one of you, and then maybe I will request all my participants who are listening. And in fact you can meanwhile also post your question while you are listening to a speaker. You can post your queries. All the queries we will be taking after the session later on. So let's start this session today. We have right now with us Mr. Murthy, straight away from again Silicon Valley, California. Dr. Amit from Gujarat. one of the leading state in terms of India is concerned. Again, Dr. Sarath is from US, I think back to Silicon Valley. Then Dr. Abhishek, again our own Indian doctor, shining uh, great in terms of Indian as well as the international scenarios. We will be coming up with the introductions of each one of them as we will be requesting them to start their sessions. So let's first of all hear from Dr. Abhishek. What exactly, as I briefed some points, that what exactly an Ayurveda doctor, being me an Ayurveda doctor, I can understand that there are so many issues which we are looking forward. So let's request Dr. Abhishek to maybe present his views. And as far as Dr. Abhishek A. Lula is concerned, he is a BMS, MD, PhD. By the way, there are very few Ayurveda doctors who are having a PhD after MD. So hats off to you, investing so much of years in education and procuring all these qualifications. He is a consultant physician at Ayurveda Pharmacy and also medical director at Nanolife Specialty Medical Center. He is an international Ayurveda consultant based in Chennai, and also he is having patients in various countries. He believes in evidence-based medicine and having practiced Ayurveda over a decade, has guided various companies in the development of patient management software exclusively for Ayurvedic practitioners. So thank you so much, Dr. Abhishek, for joining us today. And we would like to hear from you first. Why the state of a question is why an Ayurveda doctor or Ayurveda clinic or center requires a software to manage their practice. Why can't we do on prescriptions and on registers, which we are doing from last so many years? So let's hear from you. Thank you.
Thank you so much, Piyush ji, for this wonderful opportunity. So I would like to share about my life journey and as an Ayurvedic practitioner, how I have evolved. So I would just start with the screen share. Just give me a second. Is 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 it visible? Are the slides visible, Piyush?
Yes, yes, please start.
Yeah. So basically, an average Ayurvedic doctor. I was an Ayurvedic practitioner. I started off with a 10 by 10 clinic. And as Ayurvedic practitioners, we are trying to balance. We are trying to look at Samadosha, Samadhatu, Sama Agni. We are trying to balance everything. Similarly, we are also trying to balance our clinic, our practice, our patients, our billing. Most of the Ayurvedic doctors in India are a single man show. And this is how even I started with. And this is where it becomes a problem that one single person tries to do everything. Is this possible? So now we need to understand that why is it important to adapt? You all must have known about Nokia, which was one of the biggest brands. We all had a Nokia phone a decade ago, but they failed to change. They failed to change with the changing times and were left behind. The same happened with Kodak. We all had a camera with a roll a decade ago, but now we all take photos and videos from a cell phone. It's important to adapt, and this is where Ayurveda also has adapted. We have changed a lot in the last 1 decade. We initially had a lot of doctors prescribing Ayurvedic classical medicines. When I started off with, I would get patients all about the age of 50. But now with the technology, the awareness, we have a lot of patients between the age group of 20 and 40. And these patients want something easier. And that's why we had all our kashayas in a tablet form. We had capsules, oils were changed to sprays and liniments, but the practice was left behind. Technology was really not introduced, and most of the Ayurvedic doctors in India still do not use technology. So the thing here is that consultation in the future. Now we all know that with the pandemic, things have changed. The entire world has changed. Most of the Ayurvedic doctors, we usually treat only lifestyle diseases. And this treatment of lifestyle diseases is not a single consultation. It's normally over a period of months or even years. And for this, we require to be in constant touch with the patient. Can this be done online? Yes, definitely. And now you know that a lot of senior citizens are afraid to travel. They are afraid to visit hospitals. So why limit yourself to one city? What I started out a few years back on a very small note is I started out my own website, which was ayurvedicwellnessindia.com, which offered online consultation. Online consultation not only in India and abroad as well, because I felt it was required for an Ayurvedic doctor to spread and to have patients in every part of the world. And while most of us limit ourselves only to one given place. So as I started off, now coming to a question which PhD asked me is, what are the challenges seen by an Ayurvedic practitioner? Most of us, when I started up my practice, all of my classmates and my colleagues, we are all focusing only on getting patients. But where we don't focus on is on patient data keeping, on follow up with the patients. This part of follow up is very important. The time we spend to get and acquire a new patient, we don't even spend a fraction of it on follow up, because we feel as doctors, we can't call up a patient and ask him that it's been a month, how are you feeling? Some doctors don't do it. So, what options do we have? Options are very few. Maintaining inventory. When I started off with the first 1 year, this is something I'm really ashamed about. I had about 10% of stock which was expired. I was not a businessman, and most Ayurvedic doctors are not. And we really don't know how to maintain inventory. And that's when I wish that maybe I had a person who could keep the inventory and make sure that I don't have a lot of wastage, because expiry of medicines is a major problem. And on an average, I've spoken to a lot of my colleagues, and at least 5% of the stock gets expired every year. And there is a balance here. As a young individual who just completed his BMS or MD, you have the time, but just don't have the money or resources to keep a receptionist, to keep a pharmacist. And then when time goes on, you have the resources, but you just don't have the time to use a software. And this is how technology can help you. The basic thing, as an Ayurvedic doctor, I wanted help in booking an appointment, because I obviously didn't want to answer the patient's call myself and take an appointment. I wanted to keep, all the data in one place, because now with online consultation, we get patients who call up on WhatsApp, we get patients who call up on regular calls. I may be traveling, so it's not really practically possible to have the patient's file in person, and we need to have a cloud-based solution. Then billing was a major problem. Most Ayurvedic doctors are not aware of GST, and we definitely are not experts in maintaining inventory. So this normally would require at least one receptionist and would require maybe a pharmacist. Now, as a small Ayurvedic doctor practicing in a small village in India, how many of them have a receptionist and how many of them really have a pharmacist? The answer here is that we need to find a replacement. And this is where technology can help. So technology has helped taken Ayurveda to various sectors. A few years ago, I was associated with a company called NanoLife, which basically are pioneers in green nanotechnology, where we have our entire technology outsourced from the University of Missouri under Dr. Katesh Katti. And we took technology to improve Ayurveda. Like, as I said, we need to innovate and go ahead. So we started off by making our bhasmas, like for example, Rajata Bhasma and Swarna Bhasma, as a nanoparticle form, to make sure that there was 100% nanoparticles available. So what we found was that Rajata Bhasma was a very good antiviral and a very good antibacterial. So being an antiviral and antibacterial, we said that why don't we only, so we started off with first medicines, antiviral medicines and antibacterial. But then we said, why not innovate? And why don't we go ahead into disinfectants, go into fumigation, or go into tunnels? And we were the pioneers in this. Similarly, we had a Swarna Bhasma, which we are doing extensive research in US and in India on cancer. But what we found a problem, this was way back a few years ago, was that we did not have a patient documentation software, which was cloud based. Because then a few years ago, most of the softwares were all, you had to buy a software and install it in your computer. So a person who like me, who was traveling, I had to have my laptop or my desktop with me at all times. And this was not always practically possible. And the majority of the softwares available then were all based for modern medical practitioners. We at Ayurveda, we have to record certain other things. Right from a Sotas Pariksha, we need to look at the Agni. We need to look at 10 other parameters which I was not able to document in any of the softwares. So the answer was that what about making a software which is cloud based? At that time, about 4 5 years ago, there were not many options. And again, it was important to know that to find a software which is safe, because your data is like honey. You will put your honey or your cash only in a bank which you trust. You will give it to a person who you trust. And your data is as important as that. So the question rises, your data is like a money. Like an Ayurvedic doctor earns basically three things. You earn patient's trust, you earn money, and the third part is you also earn on data. So the question arises, whom do we trust? So then we didn't have many options. So we started in software which was exclusive for our franchisees of Nanolife. It was a very basic software to start off with, where we had to just look at taking the appointments. We needed something which would help in a basic dashboard, which was helping us in a visit. We would take notes, upload documents. So when a patient would come to us, like in my practice, I initially had a file, and I would tell the patients to bring in the file on every visit. Even the prescription down had a line, please bring your file on every visit. But guess what? Majority of them would not bring their file. And then again, you would ask the patient the entire history, and a lot of time was being wasted. And to have physical files was a problem. So having a place where we could upload the patient information, where you could upload the patient's all the records, the health records, and again, which was very secure, what was important. So that's when we collaborated with S10 and we made a software which is exclusively only for Ayurvedic doctors who have taken franchisees of Nanolife. And then what we did was that we found that the data entry, the process of data entry was taking a long time. You know, the other softwares also, including ours, then was taking about average of 20 minutes. So we then made an app which was given to the patient either in a form of a tablet, and the patient could fill in the preliminary data like the name, age, sex, what were chief complaints, the basic data while where they were in the waiting area. So when a patient is in the waiting area, he fills in the basic information. So by this, what happens is by the time he comes to my cabin, I have half the information what I already need. And then I just go on with the remaining part of the history taking. And then what we did was that that entire sector of Nanolife was continuing, and it still is a great business. And we have franchisees all over. We are open to take franchisees. But then we need to innovate, and we again need to get bigger. If you see, the Ayurvedic industry is growing at about 20%, and the Ayurveda has a share of 8%. The global Ayurveda market is expected to reach about 9.7 billion. And the Ayurvedic market is expected to reach about 13 billion by 2025. But are Ayurvedic doctors getting a share in this? It's only the big people who are making. And that's where I came in touch with Dr. Sarat Adanki. And he said that why don't we collaborate on another platform? I said, because since I had the experience in making a software, so I collaborated with him on a software which was on his company called Ayurveda, which was an integrated healthcare SaaS platform. And in addition to have the basic, the health record patient management, the e-prescription system, the clinical decision support and data management, we also had a supply chain integration. This was very important because, for example, as a doctor, I know what are the medicines which are kept in my store. But sometimes you always forget. And your receptionist or pharmacist may not be able to maintain the stock. Every doctor has certain medicines which are their favorite. And I wanted something which would say that I don't have to call up my distributor and say, "Bhai, ye medicine is over. Can you please send me 10 bottles of this?" I wanted something which could automatically send an email to my distributor saying that, "Why don't you send me the medicines? Because these are getting over." In that way, I thought that most of the doctors can save time. And that's what was important to have AI integration. AI integration is an amazing concept which Dr. Sarat Adanki will be explaining more in detail. And the entire benefits of the software, I would leave it to Sir Adanki. I just want to say that at last, that why is patient data very important? As Dr. Piyush Juneja rightly said in the beginning, the patient data is the most precious asset an Ayurveda clinician has. Ayurveda can only grow when we have data, and data is evidence. If you need Ayurveda to grow, and if even as a doctor you need to grow, you need to have evidence. Only having testimonials, either audio or video testimonials, are not going to help. You can get patients, but if you have to look at growth, you need to build a system. You can only grow when you have a system backing you, because as the individual it's very difficult, and this is where I think we need technology, because technology is here to help. And with that, I just want to thank Dr. Piyush, and I will hand over to him.
Great. Thank you so much, Dr. Abhishek. A wonderful talk, and you correctly mentioned about various issues which we all are facing in our day-to-day life. And you correctly mentioned that, see, data, as Dr. Abhishek mentioned, is a very precious uh, aspect which we need to understand. And as a doctor, as a clinician, as a successful, I will say, in fact, our vision is each and every Ayurveda doctor should have a mind of a successful entrepreneur, a successful business person. So if you think on that note, that is your maximum asset. So that we need to understand, and accordingly we need to take it forward. So I think excellent aspects we have mentioned, Dr. Abhishek, and we will definitely come back to you for all the questions. I request all the audience who are watching us, we are live on Facebook, YouTube, on our website and Periscope. So Facebook and YouTube audience can just post your queries as a comment in the comment box. YouTube in the live chat. Website people can just quickly click the chat bot. It is just there under this screen, either on WhatsApp or Facebook Messenger. You can send us the question directly. We will be noting down the questions, and after the each one of the speaker will complete, we'll be taking up the questions with them. And on the same note, let's quickly request our next speaker of the day. And we have Mr. Murthy. We have Mr. Murthy from US, and he is having his experience, his overall journey, his overall I can say that why he has started this, why he want to take it forward. As far as his overall experience and his profile is concerned, he is from US. He has spent his entire life, I think, of around 20 years, 28 years, more than 28 years in technology, and he is a resident of Silicon Valley, California since 1994. He has worked in leading technology organizations across the four continents, that is North America, Asia, Europe, and Australia and New Zealand. And in way back in 2015, he has developed an interest in Ayurveda. Why he has developed an interest, let's hear from him. And then, with a vision to bring modern technology to the industry, he embarked a project, and I really like this name Ayur Megha, because Megha is related to cloud, and cloud-based technologies and innovations are very very important these days. So he has developed this software, and then he has also imparted some technologies, and he also working with I think modern medicine, and also he has launched another project, that is Veda Life. And so this is basically telemedicine. So I think it's a deadly combo of combining software and telemedicine. And he has already they have done I think more than 100 appointments in US and in India also. I understand and I know, and we are aware that you people are working with one of the leading practitioner of Ayurveda in India, which we will like to hear from you. So thank you so much, Murthy, for joining us today. Your presence and your availability is a pleasure to all of us. And personally, I am also working closely with them, so I can say that they are one of the pioneers in terms of technology. I completely agree with Dr. Abhishek and Sarath. They both are doing an excellent work, and we would like to know more about them today in the next discussion of Sarath. But on the same context, Murthy has invested so many years, and as I work them with closely, and I'm using, by the way, let me be honest and let me be truthful. So I'm using their software right now, and it's an excellent software, by the way. Um so, Murthy, let's hear from you more. And I don't want to maybe add on to this, because me being a moderator, I should give equal weightage and equal exposure to all of you today. But yes, commendable job. And please start with this question, that why, being a technology person, and you must have chosen any other field, so why we have chosen Ayurveda to now infuse your know-how to this? And let's then hear from you and your presentation.
Thanks, Dr. Piyush. Very interesting in terms of, I hope everybody is able to see the screen, right? Dr. Piyush?
Yes, presentation is there.
Okay. So coming back to the question of why I got into Ayurveda, it's an interesting aspect. I mean, it all started with basic meditation. I've been running for a very long time. I average about 18, 20 miles a week. And then post running, I was using Ayurveda stretches. And that translated into, yoga stretches, and that translated into meditation. And slowly I got involved in Ayurveda. And the more deeper I got into it, the more fascinated I became with the whole concept of, how the sciences and how little exposure I had growing up in Uttarakhand, even though it was in the midst of Himalayas, but so close to Ganga, and I hardly had any exposure. And I started getting deeper into Ayurveda as an interest, and I started interacting with Dr. Vinod Krishnan in Patambi in Kerala, and I started learning some basic tenets of Ayurveda from him. And then I realized that while the science is fascinating, it's been around for such a long time, but in terms of technology, and I think some of the points that Dr. Abhishek also mentioned about data and the aspects of modernizing and security, I think those things were important. And that is how I got started in creating Ayurmegha as a software, because I wanted to bring the best of the modern technology, the best of what I had seen in terms of the Western electronic health records, and how it helps in advancing the entire allopathic and medical science, and how it's further advancing. And at least I wanted to create a platform zero where we start collecting data. And collecting data is not just about storing patient records, but it is also about in a very, very secure way. And the platform that you bring should be, well known, should be reliable. And again, borrowing the phrase from Dr. Abhishek about patients' trust, that as doctors you all earn, you cannot lose it by using software which can easily be hacked or penetrated. And for that very matter of fact, we went to partner and collaborate with some of the leading Silicon Valley organizations like Salesforce, which is a $13 billion company, and it's known for its cloud security, HIPAA compliance, GDPR compliance. And similarly, Google, enterprise Google, is what we embed inside the software, because the very first communication that you start with your patient starts with an email, very likely. And if you use a free email that comes, it essentially is an unsecure data, because Google is kind of watching that. And that's why we have taken the pains to integrate enterprise Google. We bundle a complete G Suite so that it's a paid account for you, and your emails are going in a very secure channel. We bundle it with patient portals, etc. So for us, starting this organization itself was the security and the trust was paramount, and we wanted to make sure that it was as good, if not better, with some of the leading EHRs that are available in the Western world. So that is how we started building Ayurmegha with these tenets as a foundation. And as far as we are concerned, Dr. Piyush already mentioned, we are a Californian corporate organization. We have an office in Bangalore. And we talked about compliance and trust to the platform. But at the same time, when you're looking at the telemedicine aspect, you also have to bring the same kind of trust to the patients about the doctors that they're talking to on the platform. It's not enough if you just have a platform that is secure and reliable. It's also important that they are finding and connecting with the right doctors. That is how the authenticity of the whole science grows across the globe. And today, I mean, there are tons of apps where you can find yoga practitioners. You can find a lot of Ayurveda certified practitioners. Nothing wrong with that, but at the same time, I think if this whole science has to get its due respect or come at par with what the Western medicine is doing, then we also have to showcase, highlight the best of the doctors. And that is how we started looking at creating the Veda Life platform, with that intent to bring the best of the Ayurvedic doctors on the platform. And we also felt the third dimension to this entire story is bringing the right kind of medicines to the patients. It's one is technology, you're giving them a secure platform, you're bringing them to the right doctors, but what about the medicines? Where are they being sourced from, right? So we need to bring the right kind of platform where we bring the right partners who are bringing making medicines, who are qualified by Ayush Ministry, or have the right kind of certifications, good manufacturing practices. So that is how we started building an entire e-commerce platform around this story. So overall, I mean, we as founders bring almost 28 years that I bring to the health tech industry, in addition to other areas like financials and manufacturing logistics. I've also been involved in developing a software called Dr. Cloud EMR that is primarily used for behavioral health, which includes drug addiction or alcohol abuse and a lot of those areas, which is again a $28 billion industry in the US. So we have been involved in developing a software for that industry. That actually taught me a lot about Meaningful Act, which is part of the not just the HIPAA compliance, but also about the regulations that go in selling EHRs in the West. And that gave me a lot of insight. And some of those things I borrowed and brought it into Ayurveda as well. And my other partners bring in a lot of experience from consumer goods and engineering expertise. This is a small team that we have. Darren and Ian and me are based out of San Ramon, California. And then Dr. Piyush Juneja has been kind enough to be our advisor for almost 3+ years now. And I've spent innumerable amount of time whenever I visited India, or he's been kind enough to take time off and take me around to Delhi and meet a lot of customers and prospects and help me in researching. And similarly, Dr. Vinod Krishnan is based out of Patambi. He was the initial advisor and guide to us in terms of what should go into the product. And he always came out with the philosophy of making sure that the user experience is good. It's not just the user experience for the doctors, but also the user experience for the patients, that they need to get on a system which is very easy to use. And we have architects who are certified in the industry, recognized leaders in the industry. So we have brought in a good team. And as far as the clients are concerned, we started working with some of the research organizations, because we built the software for not just the hospitals, but also we wanted to make sure it needs to touch the schools, the colleges, the research organizations, and hospitals. So we are working very closely with Dr. Gigi Gangadharanji, who's one of our earliest customers. We've completed almost 500 telemedicine consultations. IIM is again a very reputed organization, 100-bedded facility funded by the Tata Foundation, based out of Yelahanka in Bangalore. National Institute of Nutrition was in Hyderabad. They were doing some research on polyarthritis and Prakriti. We are working with AIMS very closely on some neurological sciences and cardiac-related programs. There's some research going on, so Ayurveda is being used there. So the other aspect is also the power of analytics that needs to come in addition to just the patient data management. The data doesn't make any inference unless you can look at what analysis can you bring out of the data. So like Dr. Piyush was talking about meaningful outcomes. So unless you have a very good integrated analytical tool, you'll not be able to come out with a good inference of what the data is talking to you. And we also completed about 50 consultations on our Vedalife platform with MDI, Mount Diablo Integrated Clinic in Walnut Creek. So this is an integrated clinic run by an MD, and we were actually working very closely with them on our Vedalife telemedicine platform. We connected them with some good Ayurveda doctors in India, and it truly translated into a global way of helping the patients to recover from various diseases like allergic reactions or cancer or some of the treatments that they were undergoing, and complementing that with some of the Ayurvedic treatments and medicines. So these are some of the customers that we've been working with or worked with. Now, coming back to the basic components itself, and I'll elaborate on some of the things that we heard about why do we need software. So one of the basic things is customer relationships. So Dr. Abhishek again mentioned about following up on appointments, but a lot of these things can be automated with technology that we have today. You have hundreds of patients, so it's expensive, as very rightly mentioned earlier about customer acquisition. The repeatability, the patient retention is actually increases. It can increase by about 27 to 28%, as far as the studies show. Because you can automate a lot of workflows like patient reminders, birthdays, anniversaries. So all those things, you don't need a secretary to go and look and do a record keeping. The system can automatically send messages. Medicines, lab results, right? So a lot of those things can be integrated. Emails can automatically go out with predefined templates. Referrals, right? So sometimes you also have to make referrals for MRI scans or for something else. All that can be automated with today's technology. And then we also have to look at accreditation standards, standardization. Working with, for example, Ministry of Ayush, they have developed some standard Ayurveda terminologies called NAMC, National Ayurveda Morbidity Codes, which is in line with ICD code of system. So we need to ensure that if we have to prove to the world that this is a meaningful data, there are some standards that are being followed. So we have looked at following some of those guidelines that Ministry of Ayush has come out with. So embedding them uh, in lines with what an EHR in allopathy can bring in terms of looking at what an ICD code is. So we can always showcase an NAMC code. And we touched upon the compliance aspects of the data protection regulations. So it's not enough to just give them an app to go and say that, why don't you fill this data and come back to me? Oftentimes, when you talk about a patient or a customer, Europe is very strict about where the data resides and which cloud is the data residing in. So those compliance and regulations are also important. And we have to make sure that we convert those patients who are on the borderline of fence today, thinking, what is happening to my data? If I go and complete a Prakriti Pariksha on somebody's, as simple as a Prakriti Pariksha on somebody's website, where is the data going? Because I'm exposing my name, I'm exposing my age, I'm exposing about myself. What is happening to that data? So a lot of those aspects are very important. If you have to be a standard clinic, if you have to be a world standard doctor, if you have to get that global recognition. So I think those aspects are very, very important in an EHR. Now, coming back to the models itself, there are three different models that you can look at. So the earlier model or an on-premise model is where the software is actually installed in your machine, or for some larger hospitals, it can be installed on your servers. And in this case, a lot of data security and ownership resides with you as an organization, or with a hospital, right? So as an organization, because the data is with you. Any kind of breach, any kind of hacks, any kind of security breaches that may happen, it is your responsibility. The onus is on you. And it's been around for some time, and as a result, it was getting pretty expensive to have a large IT staff to not only look at infrastructure maintenance but also database upgrades to make sure that your data is secure. So it's a one-time payment. A lot of people do come and question about why can't I pay you a one-time fee and then own the software. Primarily, I mean, these are the on-premise models, but in today's model, as we are evolving, it's all moving into cloud because we are outsourcing a lot of the data, infrastructure, security to a company which is known for its security, right? So which can do a much better job. So it's like outsourcing your IT to somebody who's good at what they're doing, and so that we can focus and good at what we are doing in terms of looking at patients. And having said that, I mean, cloud itself can go into various models. So you have to make sure that you're looking at a cloud which is proven, which is reliable, which is secure, right? So there have to be a lot of trust factors that have to go into it. And the cost usually is comparatively, it's not an ownership model, but it is a rental model. So you pay on a monthly basis, you pay some subscription, but you're not worried about what upgrades happen. The new features keep constantly coming in. So you benefit from what other customers are providing in terms of feedback. So as the upgrades come in, you also get the new upgrades, the new features. A lot of custom work can also be done in addition to some of the features that constantly come in a cloud-based model. And of course, the last one is a freemium model where a lot of companies can entice you with free models, right? So I can say that with some basic structures, so I can give you maybe a scheduling tool, or I can give you a patient management. But then as you start looking into additional areas of security or payment gateway integration or telemedicine features, right? So that is when you have different models where you start paying for those models. And there are also certain EHRs which may continuously keep it for free, right? So it could be a sponsored model where you would start seeing a lot of sponsored ads inside your software, because obviously the data in that case you're not very sure whether it's owned by the IT company or whether the data is owned by the sponsors. So you have to be very careful in terms of the contract that you're signing as far as the freemium model is concerned. So I just wanted to give you some insight about the different kinds of models that you have out there in the market and that you can pick and choose based on which way you want to go and what your comfort level is. And your size, of course, also matters. A typical EHR workflow these days, patients have begun to expect that they want to be easily schedule the reminders and get some reminders, SMS reminders, email reminders. They should be able to schedule their appointments directly on the web or on the phone. Messaging we touched upon, it happens either via secure portals, intake portals. So there are patient portals where they can do a lot of self-service work. They can complete their intake forms in a very secure environment. They can communicate with the doctor in a secure form. And then obviously, as far as the video consultation is also concerned, it needs to be on a very, very secure channel, right? So we partner again with vendors who are known for their trust, security. So we invest into some of these things. So that those things are also important, especially when you're looking at it. These days, it's been relaxed a bit given that the pandemic situation that has come in. Otherwise, the global countries have come with a belief that every channel has to be very, very secure. Of course, they're parting with the money, so you have to make sure that you have the gateways that are secure, that can't be hacked, that have been proven. There are industry leaders, and then you connect with e-commerce platforms. So this typically becomes a complete workflow. In addition to that, I mean, you can also have your partners, like I was talking to you about. Lab management could be another partner, or a referral doctor, or maybe a yoga partner in Ayurveda. All those partners could also be part of this entire workflow. And your unified experience is what your patients will like to stick with you, rather than going to multiple channels and trying to find out who's the best. And so those are some of the aspects that we also considered while designing a typical workflow for the hospitals and clinics. Of course, these days, this is a very basic expectation that your platform has to be compatible with any device, any platform, any browser. And it is given that everybody has come to expect that it needs to be, appointments have to be scheduled on the go. They need to, plus the doctors also, they need to look at, they refer the patient data as they're coming in from their home to hospitals. When they're looking at the data, they should have access to the entire history of the patient. So a lot of these things are also very, very important today when you're considering an EHR. I'll quickly touch upon some of the technology that we have built. I'll showcase. So as a doctor, one of the first things that you need is something, even before you start managing the patient data, is a lead generation platform. So keeping in that mind, we developed ayurmega.com, where we are listing only by invitation or by referrals one of the best doctors in the industry. And so this helps the patients to not only get access to one of the best in the industry without having to go all over. There are many, many channels today. And as I touched upon earlier also, it's becoming extremely difficult to find who's good, who's not good, to your proximity, who's giving you telemedicine platform, right? So a lot of those things can make it easier. So we work with doctors, we promote their blogs, we bring the best. And so this channel will help you to promote yourself specifically just for Ayurveda practitioners, and it gives you the exposure across various social media channels. And the second aspect is an EHR. Of course, an EHR comes with a lot of Ayurveda related areas, such as the Nidana Panchak templates, or Ashtasthana Pariksha, the Savita Pariksha, or your customizable templates. If you probably need a Triveda Pariksha, right? So you should be able to easily set it up. And Aushadhi management, inventory management, invoice management, taxations, connections to automatic connection to an e-commerce platform. So we kind of built all that so that when you're prescribing a medicine, you don't have to send the prescription, download it, send it to your patient. It needs to be a very, very seamless experience. The prescription, in our case, just goes automatically to a shopping cart. We trigger an email to the customer gets an email, they check out, and the medicines are actually shipped out to the customer. And similarly, what happens to the data that you're getting, right? So it needs to be analyzed. So you can see a dashboard of different kinds of analysis that can be created seamlessly, which helps you in understanding, right? So some examples you can see here is what kind of age that, by Prakriti, or how many subjects you're looking at, especially for research. what kind of prakriti analysis you can do for polyarthritis patients, etc. Right. So a lot of those things can be uh, analyzed using the platform. And this is more like a typical example of how a patient portal looks like. More like where they're completing their consent forms, they're completing their quizzes, dashboard, they can complete their food guidelines. We also have more like referral programs for both the doctors and the patients, so that they, when they're coming to you, they also get some benefits out of the whole program. So we can talk in a little more detail, if you're interested about it, on a later call or in a separate call. So this is an example of a patient portal. And this is our VedaLife.us Televeda platform, where we provide you the entire integrated experience of booking an appointment, shipping, shopping for your supplements, shipping the medicines, the shopping cart, and all that comes out. So trust, I think I would leave with that, saying that trust, building trust with global standards is paramount when you're looking at investing into a software. And the other aspect is also considering what kind of experience, user experience, are you giving to your customers and patients, so that they not only build the trust in the platform, they also build the trust with you. And that is how you can continue to retain your customers and continue to give them the best possible advice or guidance, so that it's not just for the existing conditions, but also it's not for to cure what they have come to you, but it's also for prevention, right? So there are ritacharya, there are dinacharyas. How do you essentially make sure that they're not only cured, but you're also guiding them in terms of how not they can get involved in other areas of diseases or any other aspects of that. So that is what I would leave you with that. Thanks so much for your time, and thanks, Dr. Piyush, for giving us the opportunity to present and talk about an electronic health records from an industry of Ayurveda.
Thank you so much, Murthy, for showing us the entire journey, the entire ecosystem. And I agree with you. Only software will not help. Once we have an integrated telemedicine and lead generation and supporting system, which like ensure regular footfall in terms of leads. So we need to work along with that. And very important aspects which you have mentioned, as far as data security, data compliance, the tools, the analytical tools, very important, because see, the entire world is right now looking forward for an evidence based Ayurveda, which I emphasize again and again. And as a clinician, and if we are by God grace having good footfall at our clinic, we don't have time to do all these things. So if we have something like this which can automatically do all the analytical aspects to us, so that will be a great help. So I request to you to be with us. We have lots of questions, like for example, does this software supports ICD? Absolutely yes, I can answer this. It supports ICD. And so many other questions I'm getting on my WhatsApp. Dr. Abhishek, for you also, we have started getting queries and questions. So I request all of you to be with us till the end. I also request all the doctors and participants to be with us for your questions to be answered. Let's hear from the other experts quickly, and then we'll be taking up the questions. And already we are getting very good, I will say, traffic and very good exposure of this event. And we have seen in the last week event also, till the end of the event, we got more than 5,000, and right now more than 10,000 people have seen that event. So we are expecting a better viewership for this event as well. So let's take it now as far as our next speaker is concerned. And I also want to emphasize here to the next speaker in the context of, see, we have listened from Dr. Abhishek being an international. I will quote them as an international practitioner, because he is actually, and he is having a very good exposure and very good, I will say, overall in terms of his practice, patients, and everything is concerned. Murthy again coming up from the US Silicon Valley, coming with an international perspective. And again, I think that maybe he has not specifically mentioned to all of you, but I should mention that they are having this portal which they are launching in US. So all the doctors who are looking forward for international clients, international patient, अगर आपको डॉलर्स में कंसल्टेशन फी चाहिए, तो आप क्विकली मूर्ति का नंबर ट्राई करें और उसके साथ कनेक्ट करें, बिकॉज ही विल बी स्टार्टिंग सून. एंड बाय द वे, वन कंसल्टेशन इन इंडिया इक्विवेलेंट टू 100 कंसल्टेशन ऑफ यूएस इन टर्म्स ऑफ द कंसल्टेशन फी, अगर आप ठीक ठाक कंसल्टेशन फी चार्ज करते हैं तो, राइट. So now on the same context, अभी इंटरनेशनल काफी हो गया, we have a lot. थोड़ा देसी भी तड़का लगाना इवेंट को जरूरी है, एंड अभी थोड़ा ग्राउंड लेवल पे भी बात करते हैं। एक ऐसे पर्सन से, एक ऐसे आई विल से फाइटर से, एक ऐसे व्यक्तित्व से। दिस पर्सन इज लीडिंग दिस आयुर्वेदा पेशेंट मैनेजमेंट सॉफ्टवेयर फ्रॉम इयर्स नाउ, and I respect and I definitely appreciate this person, Dr. Amit Patel. I really get motivated by his journey, by his enthusiasm, by his motivation. uh, उन्होंने काफी अप एंड डाउन्स देखे हैं लाइफ में, स्टिल उन्होंने इस एस्पेक्ट को जिंदा रखा कि ही हैज टू launch and manage and make a workable model as far as patient software management is concerned. So on the one note, Murthy and Dr. Abhishek talked about technologies, international aspects, which is very, very important. On the same note, there are some local challenges, some Indian challenges, some maybe ground level challenges, which we'll be hearing from Dr. Amit. So Dr. Amit Patel is an graduate from Jamnagar Ayurveda University. I think right now all of us agreed that this is one of the best institute of Ayurveda in India. So he's the product of Jamnagar, which definitely adds credibility and value to him. And currently owner and chief Ayurveda physician of Sattva Ayurveda and founder and CEO of Sattva Technovision. And apart from his Ayurvedic practice, his aim is to making Ayush industry digital, as proper documentation is required in this field, and everything should be on finger point. Absolutely, I agree with you, Dr. Amit. So society should accept this system more scientific way with documentation, right? So, and he is the founder of is software Vedya Manager, and one of the oldest software, I will say. And many centers, clinics, people across the country are using his software. Still he has not marketed that much, maybe whatever the reasons are there, but he is doing an quality work, and I should congratulate him for doing this. And we are very much lucky, and we are very much pleased to have you, Dr. Amit, on our board today as a panelist. And let's hear from you what exactly first of all, you are an Ayurvedic doctor. I want to listen. आप हमें बताएं कि बीइंग एन आयुर्वेदा डॉक्टर आपको कैसे लगा। आई थिंक वे बैक आपका काफी पुराना हिस्ट्री है, कब आपने वैद्य मैनेजर स्टार्ट किया, and why you started this, and then maybe you can talk on certain features and Indian context में आपको क्या लगा कि क्या what exactly the requirements are there and how we can fulfill that. So Dr. Amit, over to you. You can please unmute yourself and you can try to share the presentation, otherwise we can help you from here as well.
Yes, Dr. Piyush Dineja. Am I audible now?
Yes, please.
Yeah. First of all, thanks to Mr. Piyush, Dr. Piyush Dineja, who gave the nice opportunity and used to just create such a webinar, because it's a lot of opportunity to interaction with other people too. And now just come to the point. Earlier, Dr. Abhishek and Dr. Murthy already explained how importance of the documentation in Ayurveda, because in spite of lots of Ayurvedic physicians getting the good result, in spite of where modern medicine is fed, but lack of the documentation, we cannot just show the or achieve our goal to society. How Ayurveda is important and equivalent role in health sector apart from the modern medicine or modern science. Now come to the point about my companies and Vaidya Manager. When I was started my practice in 2010, I was just specifically looking the software which is specific used to for Ayush industry. And there are many HMS system available in market, but that's all the system is specifically designed for the modern hospitals and clinic. There is no any suitable, any specific specific Ayurveda clinic oriented or Ayurveda physician oriented. So I just lot of struggle over the that time. I just want to good platform, digital, where I want to change the making Ayush industry digitally. And that time we spend the many money too, but there is no result. And in spite of that, when I have the thought, if, for example, if I want to my own software, I minimum I have to spend minimum 3 to 4 lakhs. After the spending of the 3 to 4 lakhs, am I satisfied? Is there any regular updation or modification? Because in IT, there is a regular frequent requirement technology platform is changing, and new technology versions always coming. So that is very
Amit,
fruitful
there is some
thought
issue with your
that I
voice. Yeah, now better.
am I audible? Yeah, fine.
Now better.
So that time, I thought, is there any eco-friendly and economical model should be available for all Ayurveda doctors and clinic and physicians, where actually they struggle to maintain their physical rapport? Got it? And in spite of this, apart from this maintain the documentations or this how to enhance the practice, and we already just put the name of the Vaidya manager who actually working as a manager in Ayurvedic clinics and just fulfill the specific gap between receptionist or other staff. What already Dr. Abhishek has mentioned about the expiry date and how to manage appointments, all these things. Got it? And in spite, I was just want to two, three very important features in our daily routine practice. Got it? The first features is very important is that follow up. SMS reminder. For example, I just raise a questions. How many patients are coming in your clinic today? First of all, so might be that you are not able to say because you don't know how many patients you just given 10 days or 15 days medicine. So this is the automatic SMS alert systems are very important the features, because when the patient 15 days medicine 20 medicine is over, you get the automatic SMS alert system on dashboard in mobile as well as patient too. So that's why what the 20 to 25% follow up are boost in your practice through this digital platform. Got it? Because here the two opportunity. The patient is also used to know, okay, my medicine is over and I have to go there. They just call you and just tell the reason, okay, I will come in 2-3 days or like that. Even your reception can easily just take the follow up these dashboards or like that. The second important features what Abhishek told, that we have the many medicine in our inventory that we don't know about the expiry date and all these things. So these all the practical features are already covered. And the third option is when you go the outside in Diwali vacation or any time, when the patient will call you, sir, last time you just gave me such kind of prescribe me this medicine, but still I have the some problem. That time you require the prescription, and that time you cannot tell that I just go to the clinic and just put your take your prescription. I will call you back. That already I think era is gone right now in digital modern life. Got it? So this things is very important. Apart from the web-based, cloud-based application software, we have the Android application too, that you can carry your data wherever you go. That all the data is in your mobile in Android phone, whatever. So you can access all the data in real prescription through directly from the mobile. You should not call back immediately. You just put on speaker and immediately you can answer, okay, you can stop this medicine, you start this one, or modify such kind of the medicine what I prescribed earlier. Got it? And the third important prescription matter what we are talking, that see the image when the skin patient is coming before treatment, after treatment, they want to just compare the photographs. Even you need that photographs. Even that infertility patients, gynecologist patients used to come at your clinic, so that reports before either the semen analysis report or sonography or whatever. So at that time physician don't have the time to put the xerox and all the photographs and in hard copy. So you just take a simple directly photo from the mobile application, or automatically goes to that cloud system, because that cloud software is directly connected to mobile application all the time. So these are the second very important features. And the third one is the prescription. In Indian territory, what the most of physicians, being Ayurveda physicians, we used to write in Sanskrit in symptoms. That's not like only English. For example, if patients have fullness in abdomen after having a food, what they prescribe the Bhojanottar Udar Gaurav. Patient don't have the too much hungry or appetite, like we are just taking used to the arochak, aruchi, or kind of these symptoms, avipak. So these are the GI tract level Sanskrit actually symptoms. Ubhay Janu Sandhi Vidna. So we Indian doctors basically used to write in such a manner. So what we actually develop, our software is designed in that manner, all worldwide language supported by Google Chrome. So that's a possible. You can write your symptoms Udar Gaurav in Sanskrit too. And the second thing, you should not type all the things in front of the patient. When you just type the first alphabet, it's automatically coming out the all system, because more than 1 lakh symptoms already stored. I just want to show you in a right practical demo. If possible, I just due to share screen, if possible, just wait.
Dr. Amit, let's complete the presentation and then maybe.
Okay, no worry, fine. It's okay, fine, thank you. So this is very important that all the symptoms already just more than 1 lakh symptoms are there. So you can easily just put one alphabet and that all symptoms are coming. The second challenging, see, in Ayurveda, we have the follow-up minimum 2-3 months. We don't have kind of the cheaper practice. So patient used to for 5 days or 6-day medicine. Whenever patients, because most of the people used to come in Ayurveda for chronic ailments, right? So in chronic ailments, 2-3 medicines, 2-3 months medicine almost they are used to take it. So that time, if you prescribe the 4 medicine on earlier prescription, 3 medicines are same, but the 1 medicine is the change. So that time we have the beautiful features drag and drop. I will show you practically in a live demonstration. Right now we just finished the presentation, then just we go to on that live demo, live presentation, particularly that software features. So that feature is very important, so that we can save the doctor time in real in a live consultation. Got it? So that is very important. The third aspect is some of the doctors doing the practice along with the Panchkarma. So Panchkarma management system is also important. So we have the different kind of the package management system. We have the different kind of the single managed system, including the billing, inventory, appointment, everything. So this is the software designed specially looking to the whatever the actually requirement of the Ayurvedic doctor. It's a not like software you just take a what actually model. Even the very best features right now you can see here that patient follow the right regimen of diet or not. How can you know it? Because when you just prescribe the specific diet to the patients, and the second time if the result is not there, what you can doubt, either some mistake in medicine, either some mistake in formulation, or patient may be not following the right diet regimen or lifestyle what you actually prescribes or given. So that time how do you know that you just that patients is follow the diet or not? Got it? So we have the very built application, the patient management along with the Vaidya manager. So wherever just patients took any diets or any food stuff, they just write down on the particularly that applications whatever you given already the first consultation. That software is automatically just whatever given. If you just deny the specific diet for buttermilk, you should not go, and the diet patients already taken the butter, used to take a buttermilk at noon, so automatically that green part, yellow part, and just red part is going to, you just already know, okay, in 15 days how many yellow marker is there, how many just green parts are there, and how many just particular red marker is there. Because patients whenever you just follow the diet, it's a very crucial things. Even 10% or 20% they are following, you just simple asking, are you following my diet? They simply tell yes, we are following your diet. But it's not like that. When you actually, in even there are many diet steps in the world. Each and every item you should not it's possible to mention in the first consultation. So during 15 days in 3 times over the 45 times, actually what they are eating, you can know this kind of the applications or software, this kind of Android through Android application. Got it? And the third one is we have the specific second part of the diet. When you just go, either the doctor is going to prescribe the diet, so they have the different language. They have the Marathi, they need the Hindi, Gujarati, Keralian, Tamil, or like that. Even the different modification, Shira Shul, migraine patients have the specific diet, arthritis have the specific diet. Each and every doctor is doing his own way to do practice. Got it? And they have the different diet chart also. Some people used to just take the diet like breakfast, lunch, or dinner. Some used to just give the specific in Microsoft Word format. Some specific mention the diet stuff. So each and every whatever the diet possibility features, we try to cover all these things in this our software. Either it is related to language or diet style or different kind of the format. So this is the very important features too when we are actually talk about in the practice. And the third option is like carry your patient data wherever you go. It's always, we already talked that Android application, those there are the some of the features that we are not like just open the laptop and just put it. For For example, income expenditure, you can put directly through Android application. Manage your clinic inventory is very important also. So these all the features system, even some of the doctors file the GST report. It's a very important to manage an inventory. And that GST report, the all the GST taxable value, sales value, but we try to cover all this inventory part. And the part of the analytic chart, this is a very important features actually. For example, if you used to consult 500 patients in a year, how many patients used to come in a different tools or different platform? So how can you say without the digital records management system? Okay, for example, if you have the 1000 patient or 500 patient in hard copy, are you able to say 100 patients are coming from internet or 100 patients are just coming for like friends or relatives, or out of 50 patients like camp or newspaper or whatever? You are not able to say. But through this digital platform, through this software, you can say in your fingerprint anytime you can access, okay, out of 500 patients, how many patients coming from the Google or internet, or so you can actually know where to spend money in marketing. So many doctors are used to like digital platform marketing like Facebook or like that. So this is very important where actually you spend, because you know out of 500 patients, 185 patients are coming from the Google platform. Got it? So this is the very important features like in our software in cloud system. And manage your clinic account is very essential features to invoice payment, bill histories. Whenever the patients require, you can send mail or email or like that. So this also we just try to cover all these features. Next. Yeah, make your clinic paper free. Whatever we just, or this is a prescription format where symptoms and medicines or like that. Even in history form, we have the try to cover all the essential features like Prakriti Pariksha, Dashvit Pariksha, Ashtvit Pariksha. But after the year of experience of the doctors, they directly used to for symptoms and medicine. Some of the doctors are not used to for taken the history. First time it's fine, but second time they are only just look into the symptoms and diagnosis and specific the medicine. Next. Yeah, this is already, we already access your data on click from anywhere, from tablets or for Android application. So this is the very important line that many Vaidyas have created good case history during the practice, but they could not store the data order to show the world. The Vaidya manager created such a platform to manage your practice in data forever. And this is the very economical price we are just giving it. It's not like that the price is so very high. And we just try to just in future, there are lots of upcoming features that used to for the Vaidyas, how to boost our Vaidya practice. It's not apart from the telemedicine or whatever. So this is my particularly the Vaidya manager is our product. And we are not only just limited to that Ayurveda clinics or Ayurveda, particularly the doctors. We try to cover entire Ayush system. We have the medical software, Ayush College and hospital software that is under the name of the Atur Kosha. So we just currently 8 to 9 medical colleges are using our the software based on CCM and Ayush. We have the also the Ayurvedic resort and naturopathy center software, and that is very important. World best 5 resorts, Indian best 5 resorts are using our software. Nimba, Shanku, Five Lotus, Indo-Germans, and like Atmani. So they are the best world 5 best property of the Indian resorts Ayurveda naturopathy center. So that under the elements we just place that product. So since last 5 years, we specific focus on this entire how to make the Ayush industry digitalize. Got it? And based on that specific segment wise, just try to just build our product. For OPD, IPD, and private hospital, there is a Vaidya manager product. For Ayurveda Medical College, there is a Atur Kosh, and for resorts and naturopathy and yoga center, there is a elements. And even it's just people who are doing it in eProcto, piles fistula. We have the specific given the software for eProcto, where they live demonstration about the placing of the piles and surgery videos and upload the photographs, everything in a one click through mobile application. So these are the basic features what I just mentioned under the Vaidya manager. And we try to currently more than 160 doctors are using our software. More than 5 to 7 resorts are using our software, and more than 8 to 9 medical Ayush colleges already using our software. We are not marketed that place, but we try to best, and we try to just build in a platform in a new technology, and everything we just try to right now. So this
Thank
is
you.
what I want to say about products and making Ayush industry digital. What actually the today topics, and we try to features even some of the patients or doctors are prescribe the medicine and courier the medicine. That features also we cover in our software. So specific what actually in a one dashboard, essentially the features we try to cover under the Vaidya manager, and hope for the best feature we can do in a better, we can serve to doctor in a better way with new features and new technology platforms, hassle-free technologies, secure, and we are the using the AWS cloud system. So that is the world most secure cloud system what we are using. It's a paid version of the cloud AWS, and all the whatever the data securities and concern, we are the specific purely into industry of the software, not background doing anything or any business like e-commerce or nothing like that. So the data security is very important priority things what Dr. Murthy mentions, Dr. Abhishek mentions, Dr. Punesh Juneja ji mentions, and our privacy policy already just available in Google. Whenever you just type in Vaidya managers is there. So what we actually store, we are not, it's a virtual tunnel. Yeah, that's encryption based system totally. So this is what I'm going to tell you right now, and giving the opportunity to Dr. Punesh Juneja. If you have the specific questions about this Ayush industry digitals, or any questions about the Vaidya manager products, you can ask anytime.
Thank you, Dr. Amit. Excellent presentation, and absolutely the desi tadka you have given to us today. As far as your software and your platform is concerned, the vernacular language is definitely one of the required feature. And I request all the international speakers also to consider this. If already you have this, maybe you can answer in the question answer discussion session. But absolutely, that is a very important feature. You are unmute, Dr. Amit. If you want to say something, you can unmute yourself and say. So excellent, and we are
Vaidya manager, Vaidya manager demo is available for everyone. People who are looking for the demo, they can call our support team or person my number. We just arrange the demo online screen sharing software. We give the demo. We can give the trial. They can use it. And if you have any questions, they can ask us anytime. Without any fees, we just give the trial demo for 15 days, 10 to 15 days.
Right. Thank you so much. And in fact, I would like to clarify to all the viewers and all the audience, all the companies we will request to have a demo session for all of you. And after the session, we will share the connect details of each one of the speaker and panelists today in our comment section. And we also have a separate creative on our social media page, and you can refer to us. Still, you all have our email ID, that is info@indianvadyas.com. So if you have any query, you can let us know, एंड वी विल ट्राई टू कनेक्ट यू. हमारी आपसे एक ही रिक्वेस्ट है, आप कोई भी चीज लेते हैं, आप घर में एक छोटा सा बाइक भी आती है, गाड़ी भी आती है, तो यू डू ए रिसर्च, आप शोरूम पे जाते हैं, टेस्ट ड्राइव लेते हैं, एंड देन यू सेलेक्ट द फाइनल कि हमारा रिक्वायरमेंट के पॉइंट ऑफ व्यू से हमें क्या लेना है. एंड दिस क्लिनिक एंड दिस सेंटर इज योर bread and butter, and lakhs and in fact crores of earnings will be and are pouring in through this. तो मेरा आप सबसे ये रिक्वेस्ट है कि एटलीस्ट सॉफ्टवेयर को फाइनलाइज करने से पहले whosoever are players in the market, सबका क्या क्या सॉफ्टवेयर है, उसके फीचर्स, उसका डेमो, उसका ट्रायल वर्जन जरूर लें. some people are good in terms of the international exposure, some people are good in terms of the national, and as correctly mentioned from Dr. Amit, that background जरूर चेक करें, कंपनी जरूर चेक करें, बिकॉज सिंपल टूल्स हैं. आपको नहीं पता आपके डेटा, आपके पेशेंट के मोबाइल नंबर्स को हम सिंपल सा एक सॉफ्टवेयर के थ्रू एनीवन कैन लाइक फेसबुक पर अपना कैंपेन दिखाने के लिए दे कैन यूज दैट डेटा. And many people are offering free consultations. Many companies in fact are offering free consultations and selling products to their like to the patients. And Ayurveda doctor का एक strength है dispensing the Ayurveda medicines and Ayurveda products. So usko many can manipulate, and so you may get a tempting offer that something is free, but you never know that how people are playing with your data. So data is very, very important, and correctly said by Dr. Abhishek and Murthy as well in past, and that accredited by Dr. Amit. So मेरी आप सबसे request है कि whenever you want to finalize, that's why we try to figure out, and we try to, I think we have 5 people right now who are offering various types of softwares. तो आप सबके एक बार डेमो लें, सबको चेक करें किसका सॉफ्टवेयर आपके लिए अच्छा है, आपके बजट में आता है, कॉस्ट आपके लिए इफेक्टिव है, आपकी क्लिनिक की रिक्वायरमेंट्स को फुलफिल करता है, and accordingly you can finalize the thing. So that is the entire aim. And by the way, I would like to comment here, and I would like to quote here, indianvadyas.com does not charge any commission, and we don't work on a commission model. So आप लोग डायरेक्टली कंपनीज के साथ कनेक्ट हो, आपको कोई भी रिक्वायरमेंट है, यू कैन डायरेक्टली do the business with these companies, whatever the subscription model, whatever the pricing model is there, you can always request for if there is any discount. So you can directly deal with them, and we are just here to felicitate you, we are just here to connect you. So on the same note, let me invite our next speaker of the day, Dr. Sarath. He is waiting with very patience, and we apologize him first of all to making him awake. It's very late in US right now, in the, I think he's in on the west coast. So thank you so much, Dr. Sarath, for joining us today. And we know that it's very late, but yes, the entire America is right now not able to sleep because they are looking forward to their president. I think it is pretty clear now, but still some issues are going on. So first of all, congratulations for for developing this vision, and coming up with this an exciting product. Frankly speaking, I'm not that much aware. Today I will also learn along with other people from you what exactly the product you have. And it's good to know that you are an Ayurvedic doctor from California College of Ayurveda, which is commendable. You have a background of Bachelor of Computer Science, so you are a deadly combo of computer science and Ayurveda. And you have done your engineering, okay, so you have done your bachelor's in engineering from Osmania University. With you have a 25 years of experience, and you have developed a one of a kind of integrated SaaS for, okay, right, great, which is an AI backed database management software. So for our viewers, AI means artificial intelligence. So see, by virtue of my background, and I keep on teaching business students, I am a visiting professor in Indian ICFI Business School. So three terms are very much in, that is artificial intelligence, machine learning, and big data. So all the Ayurveda doctors should be aware about this, and we should get ourselves, get our clinics involved, because end of the day we all are big data. And if we incorporate that with the artificial intelligence and machine learning is the process, so our lives will get easy. And as already mentioned by three of our speakers, we need in this fast moving life some technology, some advanced management tools which are there for us to help us. And see, our aim is to create an ecosystem in which we have one of the best players who are offering, and accordingly we can take it forward. So Dr. Tasara, thank you for joining us today, and we would like to hear from you. And again, the same question which we asked to Murthy, being a computer person, being a graduate, and working for 25 years, why and what triggered you to choose Ayurveda to infuse your knowledge of technology and computers into Ayurveda? So you are also doing some kind of a yoga or something like that in meditation, as Murthy shared, or anything else, or any other history you have. So please start with this, and accordingly we can take it forward in terms of knowing about your software, and also what you feel are the challenges, as you have done Ayurveda as well yourself. So what you feel are the challenges and how we can address this. Over to you, Dr. Sarah.
Yeah. Thank you, Doctor. Thanks for the opportunity. And thanks, everybody, all the speakers so far. Great insight. And I also all the audience, both in across the world. Again, my name is Dr. Sarata Danki. I got into Ayurveda after losing my mom with cancer. She had cancer in 2015. She lost her battle, and that's when I decided that I got to do something with cancer wellness seekers. I don't like to use word patient. I call whoever come to me for any of their healing, I call them as wellness seekers. So after losing her, I thought I'll go ahead and work with cancer wellness seekers and guide them to win the cancer battle. So that is where I did a lot of research, a lot of study. Then at some point, I thought I need to get a proper certificate along with my research in integrative medicine for cancer. And that's when I went and finished my doctor program at California College of Ayurveda. It's around 4.5 to 5 year program, which I did. Now, again, our mission of the company is to blend the both modern as well as our ancient knowledge of Ayurveda and other complementary sciences. And our vision is to make sure, I mean, software is one of the components of what we are offering, but overall, our grand vision is to ensure that we prevent cancer by using Ayurvedic lifestyle, Ayurvedic diet, as well as ancient yoga and other exercises to keep our body, mind, and spirit fit. And also, whoever is suffering with cancer, we want to make sure that we bring all the integrative protocols so that we can improve the quality of life. And also, the most important thing is give them confidence and will to live to cancer wellness seekers. What is the need of the hour? With COVID, one of the things which we realized, all of us realized, is we got to change the way we are interacting with our wellness seekers or patients. Now, most of the people started looking into what are the other alternative ways to keep themselves fit, not either COVID or any of the diseases, to keep themselves away from most of these the modern lifestyle diseases. It can be cancer, it can be all the other modern lifestyle diseases. So they are looking out for alternative ways, or I would say more complementary ways, which are less, I would say, less side effects. So people are looking for these kind of solutions, whether it can be Ayurveda, it can be herbology, or various other forms. But the most important thing is, when it comes to Ayurveda, there is a, I won't call it a myth, but in general, feeling that it is slow, it's not consistent, we don't get the right kind of service, the response is not good. Most of them have this information in some forms, Adobe forms, or some paper forms. Still, that perception is there among the people. And also, it's not scalable. We cannot sit in one place and try to reach out to people who are across multiple time zones. And again, as I said, there are softwares, some of them are still using a lot of old technology. And again, it's very important that the new aspects of artificial intelligence, machine learning, all those things are really important. We need a digital assistant. Because of everybody cannot afford a front office, a back office, things like people like that. We definitely need a digital assistant which can do our job more in a sophisticated way while we are up and working with our patients or wellness seekers. The system should help us while we are sleeping. It should use the big data and do its analysis, and by the time next morning we wake up, it our computer should not sleep with us. It should do its work, and it should make us more intelligent and more efficient. At the same time, it should make our people who come to us for their wellness, they should get their wellness sooner than later. Again, most of the softwares require some form of mobile interface, because these days everybody have some kind of smartphone. And also, um, it is just not Ayurveda, I feel, which will make it effective. Along with Ayurveda, we also need to look into diet, as one of the speakers did speak about diet. And in addition to diet, there are lots of other ways, other complementary protocols which we got to bring to the table. For instance, in olden days, we used to use a lot of herbs which are which have a lot of fragrance. I mean, there is a reason why those were used. If they were used in the night, it gives a better sleep. If they are used during daytime, it increases our focus. So that is where aromatherapy will come into picture. Similarly, marma therapy, like that, there are a lot of other complementary modalities which are out there. We got to figure out how do we blend them together to give a five sense therapy covering all the aspects. We also need to look into that. And finally, I mean, since both of you guys have covered the protection, this privacy and the data is really, really important. We got to make sure that the data is not getting leaked out and sold in the market. Now, what are some of the most important features? Ability to track patient details, symptoms, medical history. We should be able to do a health assessment, determine their prakriti and vikruti, track their medications which they are currently taking, and also give them a confidence that the allopathic medicines they are taking are not going to interact with the drugs which are the herbs which we are giving, and also perform some automated diagnostics. This is where the machine learning and AI will come into picture. For instance, as they're speaking, let's say if you're asking about their family relationship, the moment we see that there is some tension among the family, we should be able to trigger it as one of the nidhanas, and diagnostics it should bring, saying that this nidhana might cause stress might cause suppression of their immunity, which in turn can make them vulnerable. So how do you connect all these dots? In life, connecting dots is really important. So our software should also connect dots while we are taking input or the intake forms, and automatically determine dosha, sabdosha, dhatu, agni, ama, prana, teja, ojas, shrotas, and lots of other key diagnostic aspects needs to be tracked and diagnosed. And it should also have ability to say, if these are all the causes or nidhanas, and these are all the symptoms, these will be the probable diseases. And at that time, that vaidya's or doctors job will become much more easy. And if we should also, that's where big data will also be useful. What did we do for these kind of symptoms and diseases for the last, let's say, 50 patients? Let me see those recommendations and which ones are successful, which ones are not, which ones where we were able to give relieve their symptoms, solve the root cause. All this is where is really important. That's where the analytics, which we call as in the software world business intelligence, or the AI part. So when you combine the data with intelligence, that's when it will become artificial intelligence. And when your system is learning as we're entering and treating more and more people, that's what is called machine learning. And so it's very important that these aspects should be built into the software to determine these. And also ability to create protocols and recommend it, and track healing versus recommendation, side effects, and follow-ups. See, there is also one myth that there is no side effects. That is wrong. If a pitta person, if we are giving herbs which will further aggravate pitta, obviously will have side effects. So we got to also make sure that when we are recommending this, the system should also warn us, oh, the dosha is this, the herbs which you are giving are pitta aggravated, it will aggravate pitta, so there'll be a vitation. So those kind of alerts is also really important. And and also for the patient or the wellness seeker, we should give a real-time monitoring app, so that they'll know what the progress is against the recommendations. And similarly, these are covered by other two. I won't bore you guys, but billing and as well as purchase orders, and um, predict the demand and place the purchase orders. And one more important aspect both of you covered is around expiry dates. But in any, I have maybe 25 years of experience in healthcare, so it's very important that there is a concept called batch management. We cannot, let's say I have ashwagandha bottles of 100, not all of them will get expired at the same time. Each batch will have, any expiration date is linked to the manufacturing date as well as the batch. So we should also have ability to track these herbs or the medicines at a batch level. Now, so let me quickly, so I was saying, some of these are the diagnostic aspects. Now, this is our software. Now, again, as you can see, you can track the patient basic info, symptoms, history, medication, health assessment. You can track all their reports. Then pathology, automatic determination of for any symptom, it can determine dosha, subdosha, dhatus, shrotas, and also suggest some herbs. Similarly, symptoms and the what you're seeing next to the symptoms is history. So how the historically these symptoms are, the intensity, and you can track them. Similarly, you can track the history. Again, as I said, these are all the protocols our software supports. Aromatherapy, color therapy, herbology. This is where Ayurvedic herbs, and we also support Western herbs. The lifestyle, marma therapy, meditation, nutrition, panchakarma, therapeutic music. Then you can have a summary of your recommendations, follow up with a follow-up visit, and you can do prescriptions and billing. And the next version, we're also coming up with integrative oncology. That is where all the symptoms of any cancer wellness seeker, the across three major stages, which includes pre-diagnosis, during the chemo or radiation therapy, post chemo radiation therapy, what will be the kind of symptoms they have based on the kind of chemo they are taking, what are the side effects they'll have, and what kind of protocols needs to be used. All that will be automated in integrative oncology. Again, you have master data, and where you can keep track of your inventory and things like that, and you can also schedule your appointments. And I'm just showing, again, you can go ahead, and this is where I call this as a design lab. Some of my software aspects I sometimes bring to the table, and you can have recommendation. This is where you can design your recommendations. Now, this is a totally different subject. I'm talking as an entrepreneur here, not a doctor, not an engineer. I've established my first company way back in '96 in US. So based on that, what I saw is what is the need of the hour in terms of where do we need to take Ayurveda. I see, my dream is we should have a co-op. What is a co-op? A co-op should have Vaidyas who should be able to offer video consulting, a phone consulting, or a on-premise. Then software vendors. Again, I see each of these softwares have one uniqueness. For example, Veda Life, the front end, the ability to interface with clients is fantastic. On the other side, Vaidya Manager, they have the Indian aspects of covering in the language. It can be the symptoms, it can be the Sanskrit. So each of these softwares, we got to figure out how do we bring them together to cover the end-to-end process, including customer facing, back-end, analytics, even go to the next level of, can we even do some clinical trials across and be very proactive? Somebody asks us a question, where did you use? Yes, we have used across these 500 places, the same herb, and these are the results. And even extend it to the health plans and have facilities, manufacturers, and research and development, and also sales and marketing. And finally, when you have these 5 components together as a co-op, because what I see very frankly as of today, again, no offense, my whole goal is to make sure that how an Ayurvedic doctor can be financially, I would say, secure. At the same time, they should also do their Vaidyas Dharma. How can we achieve both? That is what I was thinking, last few months. That is one thing which I see, that which is, for example, when I look at software, it's a very lucrative industry. You get a project, you get a decent margins, and you grow and you make money, you are very happy. Again, I'm not saying money is the only thing which requires in life, but it gives the financial stability and security. For instance, during COVID, lots of these clinics were shut. So do we really have, if one more thing happens like that, can we sustain? So that is where I was thinking that we all need to get together and figure out a co-op model where we have to bring all the resources which all of us have under an umbrella, and to really launch something where each one of us can own a piece and really do our Vaidyas Dharma, at the same time our Swadharma, that is taking care of our families and the people who are depending on us. So I'm going to stop now, and any questions? Anyhow, I thought we will be discussing in question and answer session. I would like to, because I want to make sure that I finish off in 15 minutes. Again, we have the software ready, and we can deploy it. And I feel that software is only one aspect of the entire story which we got to cover, because I feel that it's a piece of the puzzle. It's not the puzzle. Thank you, Dr. Piyush Juneja, for giving me this opportunity. Hope I covered the aspects which you are looking for.
Thank you, Dr. Sharath. Excellent presentation, and I would like to appreciate your vision and your thought in terms of creating an ecosystem, and you have correctly joined all the dots. And in fact, starting this portal, this platform, and this, you can say, we will see this as a mission. That is IndianVadyas.com. The only mission is to encourage and to motivate and to see that all the Ayurveda doctors are at a good financial level. You correctly mentioned about the Vaidya Dharma, but however, we have seen that Ayurveda doctors, and in fact the entire Ayush doctors, I would like to say, being exploited many times, either by their own reasons or by the industry at many aspects. And this is a high time we all need to be smart now, and we all need to understand the modalities which are there, because yes, we are here, we never intend to I would say uh, make money in a wrong sense, but making money with ethics is always there for all of us. Everybody here is doing our jobs. In fact, we are started and we are advocating this campaign of saying no to free consultations, and there are many more aspects. So I appreciate your vision, I appreciate mindset and thought, and definitely your experience from software and technology will add an advantage to this entire thing. We are getting many questions, I can see in my WhatsApp. in my messages, because there is a very huge number of people who are watching us on our website as well right now. And I can see on Facebook and on YouTube also there is a good number of people who are watching us. And I request all of you to start posting your questions now. We have the final speaker of the day, and after that we will be taking up the questions with all our esteemed speakers, and we will be starting the question answers round soon. And so we have the last speaker of the day, and let's quickly go to him, and accordingly we will be taking forward this session, and we will be like starting the questions. So the entire idea of doing this exercise is to get good people in terms of the technology, in terms of the background is concerned. Then also we thought to have a few people from the Indian subcontext and Indian background. So Murthy and Dr. Sarath is coming with an exhaustive experience of technology with the best place, that is Silicon Valley in this world, and they are infusing their information and knowledge to Ayurveda. Now we have Dr. Abhishek, an ideal example of a young doctor practicing Ayurveda and also using the technology. We have Dr. Amit, again, both are the doctors in terms of practicing and infusing. And Dr. Amit created this Desi Tadka for us. Now, finally, we have a person. He is not a doctor, by the way. He is Mr. Anshul Agarwal. And however, he is having an exhaustive experience of this Ayush domain from an external perspective in terms of creating events. One of the largest event of Ayush industry, that is Yogshala, is headed by him. He is virtually heading the entire event from last so many years, and I got a privilege and opportunity to get associated with them in several capacities. And I closely see the vision and the work Namo Gange group and they people are doing, which is appreciable and remarkably under the able leadership of Mr. Vijay Sharma, the chairman of this group. So they are again connected to the ground level, and they have worked with several companies, several organizations. They own a chain of clinics, that is Yogshala centers, and on the daily basis they are doing services like yoga, Ayurveda, and all. And recently they have launched this platform, that is Ayush Mitra, in which it's a model people can request and get home services as far as yoga, panchkarma, and other modalities are concerned. So they are upcoming with the software as well. So let's hear from Mr. Anshul Agarwal, and let's hear the vision, the mindset, why they want to offer this software, what exactly the challenges they feel or maybe they are having right now as far as in this industry is concerned. And thank you, Anshul, for joining us today. And thank you for creating and heading this event, that is Yogshala Expo. We are looking forward for the next edition very soon. And it is one of the largest in the Pragati Maidan, Delhi. Every year they are doing this. And I must appreciate and congratulate them for doing this as well. Thank you. Thank you, Anshul, for joining us today. And over to you.
Thank you so much, Dr. Piyush Juneja ji. I believe I am very much audible to everybody.
Yes, yes, please proceed.
Great. First of all, I would like to congratulate Indian Vedyas to give us this opportunity, this platform to speak with the people with reference to the basic needs, what all the doctors and the center owners wants in today's time. Apart from that, a very warm welcome to all the panelists who are there with us. Well, if we talk about specifically about the software, what we people are working for, it's nothing like that. Seriously, we started this journey 5 years back when we opened our own center in Delhi NCR, and we have learned everything from our own experiences. On the initial stage, we don't have any idea to create any software or to go in this particular genre. But when we have faced the challenges while running our own center, so we thought we should come up with something out of the box. So we have created a software in which we normally give the solution to all the center owners, that how they will deal with their day-to-day challenges. That is the main thing. Normally, what we have seen, that whenever any center owner is operating any day-to-day OPDs, normally they face the problem with the doctors. Sometimes what happen, doctors are changing on the continuous basis, right? So in terms of data management is concerned, it becomes very tough to handle the things. So when we talk about Ayush Mitra specifically, the main USP for Ayush Mitra is the line of treatment, specifically for the pre and post diagnostic histories. Even though one can easily do the Prakriti analysis as well, right? Panchkarma facilities, all the options are available there. It's not only about the doctor perspective. If we talk about the center owner perspective, you can control the your complete HR wing with the help of this software. Apart from that, your admin, your operations, your stock analysis, you can easily check out everything. Just now, one of the speaker was talking about the stock analytics, right? With reference to the batches are concerned. Similarly, when we talk about the Ayush Mitra, they also give you the pop-up with reference to the expiry dates, that you have these products are available in the stock and these are going to be expired soon, right? Likewise, PR management, we are also giving the facility. I mean to say that regular messages are going to the your patients with reference to their dosages, with reference to their regular input. So it's a very easy to use software, very friendly. If you are using this software, it makes your life very easy, specifically in terms of your daily usage is concerned. I'll try to share certain screenshots for the same thing. Dr. Piyush, is this visible?
Just click on the share screen on your monitor.
Is
Yes,
this
visible.
visible now?
Yes, please
So
proceed.
this is the main view of the software. If we start from the basic dashboard, it gives you the complete entry, the rate card. First of all, for whatever the services you have, you can add on all the services as per your requirement, whether it's yoga, whether it's Ayurveda, whether it's Panchkarma, whatever the add-on you can do. Likewise, it's a demo of one of the center we have in Kalkaji, right? And we have already added all the basic therapies in that. Apart from that, you can add on all the visitor data in this module. Client database, you can add all the type of clients. Then if you want to give the demos to any of your client with reference to yoga is concerned and the other yoga services are concerned, so all the options are available in this. Likewise, while I was talking to you with reference to the Panchkarma services, you have a complete list of active clients, inactive clients, then
We are
their
not
in.
able to, yeah, Anshul, we are not able to see this. Just home screen which is flashing. If you can scroll down and
uh,
just maybe take us to the tour. It's just written our projects and the icons, right?
Just give me 1 minute. Mhm. I'll just connect once again. Is it visible now? Is it visible now?
Yes, yes, it's now fine.
Right. So, if you talk about Panchkarma services, you can easily see that how many patients are active with you, how many patients are inactive with you, how many patients are having the Panchkarma services and other services. Likewise, what all packages you are giving to what patient, OPD services, then any sort of health camp if you are organizing, who all are coming to attend that thing. See, in terms of your database, also you are maintaining on a very regular basis. Then what all products are available in your center, how many you have sold out already, what is the inventory you have, when this inventory is expiring, what all consumables you have, your purchase and procurement, that when your day-to-day expensive, this is one of the major tasks which normally most of the center misses in terms of their availability is concerned. So expenses is one of the major section what we have insert in this software as well. You can easily handle all your expenses, your accounts, your profit and loss account, your P&L, your balance sheets, everything with the help of this software itself. Then your attendance of the employees also, who all are coming, even though you can easily take out their monthly salary slips also. I mean to say, in totality, if you are using this type of software, it will help you in handle your whole center in wholehearted way. Moreover, yes, moreover, in terms of pharmacy is also concerned, whatever the things you have in your center, inventory records, profit and loss accounts, PR management, expenses, salaries, administration, HR, operations, medicines, diet planning, your everything is available. And moreover, we people are not that much professional in terms of the technical aspect is concerned, but when we start creating the software like this, we got the experience. We are already running with three centers right now in Delhi. NCR 6 are almost in and proposed to come. We are already handling more than 2000 patients at present through this software, and we are already sending a very regular update to them, and they people are also in touch with us. We are getting a regular feedback from them, and patients are also very happy because they are getting a very regular reminder from the yogshala is concerned. So I just request the people to they can ping me up any point of time for a demo of the same thing. And Namo Gange Trust is always there to serve specifically for the Ayush industry, and we are already working for the same. Thank you.
Right. Thank you so much, Anshul, for this specific discussion. And I appreciate again, you people are doing excellent work as far as uplifting the Ayush system and domain is concerned. I quickly request all the speakers to join us back on the screens. We will be starting the query discussion. I request all the participants. We already got around 20 questions on my WhatsApp. I can see as far as the website audience are concerned, and we have lots of questions for all of you. So I quickly request Murthy and Dr. Sanat also to join us back again, and let's start the question answer round and question answer discussion. So the first question is for you, Dr. Abhishek, and Dr. Amit from Faridabad is asking this. He wants to ask that as a doctor, although you have mentioned in your discussion and in your talk, still specific any aspects which you see in a software. So I think he wants to out like maybe we have offered him so many options today. So as a doctor, what exactly he needs to think or he needs to check as far as finalizing a software is concerned.
Right. So this is an excellent question over here. As a doctor, we have a lot of options, and even here we have amazing softwares. So I think that everyone has their own requirements. So you need to look at basic three things. One, a software has to be easy to use. B, you need to see that, like, is your data secure? And as Dr. Piyush said, that don't go for anything free. Look at the contract. Again, you need to look at the other features. For example, if you have a hospital, if you have a Panchakarma center, does your software provide options for Panchakarma? You also need to see, because as a practitioner, the main thing is time. So a software should help you to save time and not take your time from you, because there are certain softwares which will take you about half an hour to feed a patient's data. And I think, like, having used about 4 to 5 different softwares, I've seen that a software should help a doctor, so that if on an average, if you see 10 patients, by using a software, it should save your time, and you need to see it in the same time, instead of 10 patients, about 20 patients. So that's my view.
Right. Thank you so much, Dr. Abhishek. And next question, I think Murthy and Dr. Sanat, both of you can answer this. Dr. Sanat and Murthy both can answer because the question is specifically, and in fact, it is in my mind as well. Thanks, Dr. Sushma Rai from Kolkata, for posting this question. So, but she wants to ask, and I think we have seen this query in terms of there were some apps and there were some discussions that data is saved on which server, it is international or national. If it is an international, so it's like data is going to outside India. Is there any geo mapping also? We have seen. Let me explain. Geo mapping means although the company is international, but the server is only supposed to save the data for the Indian context, and it will not be shared on the international platforms. So I think there are some confusion still, and this has to be discussed today. So Murthy, first we will start with you, and maybe Dr. Sarath can add on to this. So if data is there, so how it will be like saved, and how we are ensuring that it is protected, and is there any harm that if we say that data is going outside India or what? Murthy.
Sure. Thanks, Dr. Piyush. So thanks, Dr. Sushma, for asking this question. There are two aspects to this. One is where should the data reside, and what about the security of the data? So the data residence, as far as the compliance is concerned, when you're looking at most of the health records, every country would want them to reside in their own countries. That's why I was talking about GDPR earlier. Europe would not want its data to get out of Europe, or similarly US. I mean, it has very strong HIPAA compliance. It doesn't want the data to get out of US. India will come up with similar regulations as well. And so your data is not only should be local, but at the same time there's a security aspect of it. Who should see what data? I mean, the data cannot be open for everybody. If you're putting a very sensitive health record, the receptionist who's booking your appointment should not be seeing it. What kind of encryption tools that you can bring? Because today or tomorrow you will start integrating this data with third-party systems. So there are very strong encryption rules that come in, especially in the West, even for transmission of data, not just storage of data. Right? So even within data, there has to be a masking capability. You can probably see certain aspects of the data. You cannot expose some sensitive data like the patient's gender, PAN card, or some of the other information that that can come in. And then there is role-based security that comes in. Who can see what? And there is an aspect of reports that you're getting out of the data. Even in that, you have to make sure that inadvertently you're not sending out some data to the patient that they are not supposed to see. So there are three aspects here. One is residence of data. How do you securely store the data? And the third aspect that I can also talk about is how accessibility of the data to you. Can you easily download the data? Can you export the data? Let's say today you're not happy with system X. What is your mechanism of backing up the data on a daily basis, on a weekly basis, and how do you export the data out? So I would probably touch upon these three areas as far as the residence and security of data is concerned.
Dr. Sarath, anything to be added from your end?
Yeah. So one most important thing is who owns this data. The patient owns this data. So that's the first thing which we all needs to make sure that we understand and we appreciate. Again, in India, the laws might not be strict, but as we are talking about globalization and Ayurvedic doctors reaching worldwide, it is really important that we pay attention to HIPAA laws. So patient owns the data. So we can go get a software which is selling our data, our patient's data to somebody, but who will be responsible? The Vaidya who is seeing that patient will be held responsible in international court. So it is very important that we all understand that who is the owner of this data. That's where we are working with a company to really bring blockchain technology so that whenever the data gets shipped, the first request goes to the patient only when they allow, give the permission, you can really share the data. Let's say there are two experts. One is a Vaidya who is seeing a patient, and the Vaidya wants to discuss about this patient with a specialist. And if he wants to share the data, the first thing we should do is go and take permission. Can I share your data? And legally get an approval, then share the information. So, what I saw during my visits is we take the information about patient much more easily. I mean, even the kinds of discussions happen inside a clinic is we let the information, sensitive information, go out very easily. So it's very, very critical that we pay attention, especially in the panchakarma places and all. I see there are a lot of leakages of information. So we got to tighten. Overall, we got to be more serious about data security. And as Mr. Murthy said, who should see what kind of information, and also train the entire staff on the importance of patient's information. That way, when we actually become a global, go global, it will become a natural for us to protect patients' data, and we will be protected from lawsuits. Hope I added the other dimension to the.
Right. Thank you so much for this clarification. And absolutely, I agree with you and Murthy with all these aspects. We have a couple of more questions for both of you. So please be with us. Dr. Amit, a specific question for you. As you mentioned about languages, Dr. Shivika wants to ask how many languages are there in Vedya Manager as far as vernacular languages are concerned. In fact, I also want to ask one question adding to this. I was thinking when you were showing us. Actually, we have seen in languages, I worked exhaustively in clinical research. So there are some issues in terms of fonts, in terms of printouts. Like sometimes we are just entering, it's showing good in the soft copy, but when we do a printout, we are not able to get exact. So there are some challenges. So Vedya Manager will address all those challenges in terms of in seeing the soft copy as far as the vernacular languages are concerned, and also in terms of the hard copy, or also for typing also there are some challenges. Like for example, I have a QWERTY keyboard, so I'm not aware, or maybe you can teach us, all of us, how to take all these aspects whenever we are using the vernacular language.
Yes, Piyush, are you getting me? I'm
Yes,
audible?
yes, please.
Yeah, it's a nice questions. Actually, Vaidya Manager supported all language in the world because it's a cloud-based applications and it's a directly connect with the Google Chrome input language. So whenever you just show the input language, there's the list of the language available in local regional language, Tamil, Marathi, Kannada. Each and every language is supported in our software. Even I can show you a live practical demonstration in our practical entry, even in diet or in symptoms or whatever. Even if print out is there is no any issues. You just want to say just in Chrome, you simple download the input to language and download the extension, and whatever language you want, you can just type it. The second most part of this question that what Dr. Piyush is asking, that see, no doctors are used to like quadri keyboard in language or like Kannada or like that. So you should not type like that. For example, if you want to type it Udar Gaurava in a Sanskrit, you should not like type out Udara. You have to type it in English. When the English is converted directly in Google Chrome, that's already just available. That option, you select the selected option, and directly the software take it. Got it? So in language, there is no option either in prescription part, either in diet part. Even if you can mail it, you can print out. There is no option at all. There is no any problem at all because we already using this technology since last 5 years or almost 4 to 5 years. So there is no issue about still any doctor find any language issue. So it supported each and every all language what Google input tool is supported.
Okay, thank you so much for this. And in fact, there is one more question from our YouTube participant. How this software are helping for development of suitable or appropriate remedies? How will it make how will it help to make choice of therapy? So maybe you can start, and I will go to other panelists also. Anshul, if you are there, Dr. Sarath, and maybe Abhishek also can. I think it's a generic question for all of us. So let's start with Dr. Amit and quickly go to other panelists also. There is a very important question that how this software will help in development of suitable or appropriate remedies. I think she wants to ask that. Let me just mute all of you. Yeah. So I think she wants to ask, and let me clarify. In fact, the idea of this question is we have this in our mind as a clinician that this particular medicine or this particular therapy will help. However, the software will pop up some suggestions. Software will pop up some is there any artificial intelligence related to like if we type some symptoms of disease, do your software helps us in that as well? Sometimes it helps us in judging, and also, or what kind of features your software is having? Right, we can start with Dr. Amit and we can quickly go to the other panelist also.
Yes, this is the nice questions. Actually, since last 5 years, many doctors are used to ask this question. Okay, for example, is there software is able to diagnose me automatically or find the specific suitable remedy? But what, as far as software development, technology aspect as well as doctor aspect, I can say you clearly, don't go right now. In at least next to 4 to 5 years, get software is just suggest you diagnosis or symptoms, and based on that samprapti you just type down a remedy or herbal formulation, because vaidya is the yokta, and in ayurveda it's not like modern system. There are the vikar, prakriti, adhishtan, even as samuthan, samprapti, each and everything. Even if, for example, you simple taking the vatik pratishay, so there are the different modality. One you ask one nidan and then just hetu causes factor. So I don't say directly can say that AI is the suitable modalities for you. Even I give you the simple example. For example, there is a pitta vikar, and you just want to prescribe the tikta kashaya madhur ras. In a tikta kashaya ras, there are the 10 remedies in tikta rasa. There is a kutki, there is a indraja, there is a kiratikta, there is a androgaphilus paniculata, then there is a nimba, there is a katuparvala, there is a chandana, there is a indigo nili. So there are the 10 different kind of the drugs belong to the tikta rasa category. But which drug is actually useful? Because Ayurveda is not like that. Each and every system is connected to the different system. For example, patients is coming for in urticaria shitpit with the vidagdha state. The remedy is totally different. The vidagdha in the same patient, some other patients is coming with viband or udavart. The remedies or mode of the formulations and the selection of the ingredients is totally different. So in the software part is little difficult to say that AI based exactly you are prescribed. Yokta Vaidya Pradhan in practice, whatever the four pillar about the mention in the Ayurveda. So I personally believe that don't particularly right now in the next 2 to 3 5 years, you just depend on the software to which suggests the remedy and you are going to prescribe it. Better you enhance your knowledge and you just use the digital platform as a specific documentation and digital record. Whatever each and every doctors, what I have my experience, even as fathers and sons are doing in a different way, same disease, same persons in a different formulation. So in Ayurveda, there is not standard procedure. There is a typhoid, or there is a specific malarian drug, or there is a specific gist fever, dolo or paracetamol like that. Ayurveda has the different or wide variety. What actually Prakriti Vikar, you want the persons you being a doctor. But in software tool, AI based, what software suggests you are going to prescribe, it's ultimately going to mash up. What personally I believe it. Got it? Because there are the lots of factors, habits or everything or like that. So this is what I experienced since last 4 years. Don't rely on that software that suggests or particularly that you just use the digital parameter, enhance your practice, documentation or like that. Of course, last 5 years there are a lot of database. You have to 5,000, 10,000 or 5 lakhs patients, and that application like right now Pythons or all different kind of the just used for AI, that the specific used to in AI technology. But that's a lots of, because standardization in Ayurveda is now big challenging. Whatever I diagnose is, it's a different my perspective. In other doctor is a different perspective. It's like Gita. How many doctors? How many like kind of the Gita like that? Got it? So this is what I trying to tell you. You don't specifically rely on that software. Of course, you just use that particularly combination. For example, Chitragati. You don't know how the type of the ingredients are there. You can use the digital too. It's a very nice approach. 200 or 2000 formulation you should not be remember at the time. It's available on fingerprint in base of applications or softwares or like that. For reference you can use it, but for final diagnosis on delivered drug, don't rely specific technology right now. This is my final answer.
Right, great. I think I completely agree with you. Still, is there any aspects which we can explore, Murthy? Your take on that, and we will quickly go to Dr. Abhishek and Sarath also for this. It's an important question. So, Murthy, what do you say and what do you feel on this aspect?
No, I totally agree with Dr. Amit. I think we are here to develop software for record keeping, not to create doctors. That's one of the basic things. Having said that, I mean, it has taken years and years of creating an automated car. For example, Google is test driving an automated car. So if you look at the amount of data that they have collected over a period of time to teach a car to drive by itself, requires not only a lot of money, but it also requires a lot of testing and a lot of teaching in terms of how it goes. And as you all know, Ayurveda is a very complicated subject. There are a lot of combinations, there are a lot of different things that you have. In general, I mean, medicine by itself is a very complicated, and it is very, very personalized. So, and I opened up my statement saying that this is platform zero. So we have not even started to collect the data. So where are we in terms of looking at creating a mechanism for data science, or looking at coming up with intelligent outcomes, or appropriate remedies? But having said that, it is not that it is not doable. It is also not that you can have a very thorough integrated search mechanism where you should be able to retrieve the data quickly. And there could be some protocols. I think Dr. Sarath is already working in this space, and having interacted with him closely. So some of those things specifically that he has created, I think he can talk about them in detail. But it is not that it is not doable. But I think if we have not even started using the software, I would go with Dr. Amit's statement that at least start collecting the data, and then we can go to the next level.
Dr. Abhishek, what do you think on this aspect?
So with this, I agree with Dr. Murthy, and the thing is that actually, I have been interacting a lot with Dr. Sharath Adanki, and Dr. Sharath and I feel that yes, this actually AI can help. We're looking at least a few years from now, but what a doctor can do now are basically two things. First is, for example, if I have one rare patient about 4 or 5 years back, and I have successfully treated. But then I get another site, but then in our practice we see the normal routine cases. But then if I have the data, I can see that 4 or 5 years back, what did I use to treat this given patient? That's one part. But the second part is giving suggestions. I feel that most of the Ayurvedic formulations are different. But if we were to use the data and see that which are the common herbs, so, I'm not saying that that's going to help you in diagnosis. Diagnosis is what a doctor needs to do. But in terms of the availability of the drugs, I'm 100% sure that with AI and the software, we can get recommendations. For example, in my pharmacy, I want to give a patient, for example, Manjari Kada, and it is not available with me in stock. Then what a software can do is you can say, okay, fine, we have these other options, which again have the same rasa, virya, vipaka, and this will happen when I have about 1,000 odd patients of skin diseases, which I have treated by using my own yukti. So a software can definitely help. And in terms of the pharmacies, if you look at the broader aspect, we have a lot of companies, a lot of Ayurvedic manufacturing companies, which have their own clinics, like they have about 50, 100 clinics all over India. So what they can do is that they can use the data of all the clinics to see that which are the herbs found in the given formulation, to create more proprietary patent formulations. So with this, I think that, and I would want Dr. Sharath Adanki to speak more on this because he is an expert in AI.
So thank you, Dr. Abhishek. See, what I feel is a doctor can be very experienced and have lots of knowledge, but on any given day, if the diagnosis is depend on the doctor's presence of mind, I feel that there are some subtle aspects we miss. So what we got to do is there should be a dashboard which should collect all the intake information, present it so that our diagnosis can become easy. Now, that is where I feel that there should be some amount of AI and machine learning should be used. That is first step. Is do we remember all the information given by the patient when we are deciding which herb are we going to prescribe? That's the first thing we all have to ask. The answer 50% of time is no. If it's 100% we are all accurately giving, that means there won't be any diseases out there, or every patient will get cured very fast. So there is some element of efficiencies we got to bring to the table. So how can we collate the intake form in a systematic way, present it, as I said, as simple as nidana. Patient might be talking to us on let's say at length. Again, one most important thing is, I also disagree with lots of doctors. If we say I'm going to do a OPD in 15 minutes and be done with it and use my Ayurvedic knowledge to prescribe because I'm very, very unique, I don't agree with that. If we want to go with a traditional diagnostic way, spend an hour with a patient. If we don't have an hour to spend, then we are cutting short. Then at least use a software to really figure out, to let them enter all the information upfront, and at least let the software do it. So it all depends on how much time we are spending with each patient, and how much of information which is collected from the patient is being collated and presented in a way so that we can come to a meaningful conclusion about the person, not the disease. Because we are not treating diseases, we have to treat a person, because that is where the uniqueness will come into picture. And the software should be used for two things: collating information, letting the machine learning AI give us suggestions. We use our intelligence and our expertise, but at the same time, as Mr. Murthy said, just like the way Tesla car is driving on its own after collecting, thousands and hundreds of thousands of miles of data, we got to start that collection today. If we don't start, we'll ever be driving a bullock cart. So let's start collecting the data. Hope I answered.
Great, great. I think this is one of the best aspect which you have mentioned. We have limited time now, but questions are pouring in, and we can't control. So quickly, we will have 2-3 questions, and I request all the panelists to be just crisp and short to just explain the aspect which has been asked. So let me answer this. Informed consent is not required, Dr. Rajesh. Yes, but if you want to do a clinical trial, or if you want to do some kind of a research out of your patient data, then definitely you need. If you want to do a surgical or parasurgical procedure, it's a general habit. So it's like just an electronic version of your. So it's like somebody is walking in your clinic, you are writing a prescription, you don't take informed consent with all the patients. So it's just your records are getting digitalized. It's nothing apart from that. But yes, if you are doing a clinical trial, if you are doing a clinical research, if you are doing a surgical or parasurgical process, in fact, we recommend before any panchkarma procedure also, you should take consent, because sometimes there are complications of Vasti Chikitsa and other Vaman and Virecham. So Panchkarma should be done after taking consent, as all the surgeries and all the other procedures are being done in other pathies. So you should do in parasurgical for anorectal, Shar Sutra Karms, Agni Karm, Jaloka. All these karms you should take informed consent in clinic. And if you are taking in clinic, whether you are managing your data on electronic or paper record, that doesn't matter, right? So there is one another question for Dr. Amit.
Dr. Piyush, I just want to add
Yes.
there, from an international perspective, informed consent is required irrespective of what you're doing. Because what happens is you're doing teleconsultations, you're recording video, you're recording somebody's data, right? You're also collecting somebody's data. At the same time, when you're talking about Ayurveda consultations, you also have to give an informed consent saying that Ayurveda is not the primary form of medicine in US or Europe. This is still considered as a complementary. So you have to take the informed consent in a secure digital signature format from the patient, especially in telemedicine, to say that they understand what they're doing, just in case. Again, Dr. Sarath was talking about international courts and laws. These things are potential lawsuits that can happen if you don't keep a good record keeping inside your systems.
In
And that is why
fact,
there are some expensive software like DocuSign, everything. There's a lot of money spent, because even the security, the signed signatures that you take, it cannot be just a scanned copy and sent out. It has to be in a very secure and authentic way. Sorry, Dr. Sarath, please go
No,
ahead.
no, no, no. Sorry to interrupt you. So I just wanted to extend that. In fact, one is informed consent, which is must for all the international patients. Second thing is, if we are taking any of their medical records, allopathic medical reports, a HIPAA signature of release of information is required. So the separate form for HIPAA. Generally, let's say if you ask them to show them their blood report, you can't just take a blood report. You need to make sure that they give you the consent form, then take it and load it.
Right. So, what I feel, and from this discussion, what I think is, let's have a separate session. We are having queries, and you both are doing excellent work in international scenario. So, we will quickly have another session, and in fact, we will request all the doctors and participants who are listening to us today, if you want to get on board as far as international consultations are concerned, we welcome all of you. However, you need to get some training and some basic understanding. So we'll be doing another session with both of you, and it's a kind of a workshop maybe for all our doctors. Whosoever will be interested will be joining us. It will be a like closed session for selected doctors to guide them and to train them how to take it forward in terms of the international consultations and international regulations are concerned. Thank you so much, both of you, for this input. And quickly, let me ask Dr. Amit, there is one more question for you. So, as you have already mentioned about your software, and Dr. Rajesh is asking, so is it giving any correlation between Hetuling and Oshad as far as your software is concerned? And otherwise, as you correctly mentioned, that Vaidya should use their own knowledge and experience to determine that. So your software will help in any aspect, or it's just we need to determine, and accordingly your software will help to correlate. You can just unmute yourself and answer this.
Yes, am I audible? Yes.
Yes.
Currently, actually, in Hetu Ling Aushadhi, there is a Triskan Dilip Gargil in Pune. Is doing a very nice work actually, and he is also using our software. And just we want to just correlation that Hetu Ling Aushadhi, that database to our software. The problem is that whatever they have, the data is not in correctly digital form. Now they are going to convert each and everything in digital form. In hard copy, they are doing very nice work. So currently it's not available, but in future it's maybe available. And one more thing I want to clarify: in Hetu Linga Aushadhi, you just take a use as a reference, not to just only diagnosis, because diagnosis is the final conclusion that you hold the charaka, hold the Hetu Linga Aushadhi, just you correlate each and everything, and just final conclusion the Vishag or Yogda. So currently it's not available, but we are just trying to incorporate it in futures, because we are doing the specific this part only in our softwares or like that. We are constantly trying to enhance the new features.
Okay, great. Thank you so much. Let's have the
Yes,
final
thank you.
question of the day, and let's conclude the session. We are already 2 hours, beyond 2 hours, and I think Dr. Sarath will be a bit late now, and he should get a good sleep. So quickly, let's have this final question, which is, in fact, especially in my mind also, and in all the doctors today, because right now I want to quote this is a turning point for all of us, and I request all the doctors who are seeing us live or who will be watching this video after this session, please get as soon as possible digitalized. Please get as soon as possible your clinics to be connected to a software. This is the need of the hour. I have seen so many allopathic doctors gradually are converting, and we should also get as soon as possible. In Indian Vadyas, our aim is to market you. Yesterday, I got queries from, I think, 5 doctors called me. They have started getting queries. We are on the first page of Google in 10 cities now in India. So they are getting numerous queries, numerous calls. It's completely free of cost for all of you right now. But we will have some premium listing as soon as our traffic will increase. However, as far as software is concerned, so the question, the point is, they are getting queries, they are getting business, and our aim is to promote all of you so that you can all, as correctly mentioned by Dr. Sarath, that financial viable model should be there. Why not an Ayurveda doctor can earn in lakhs or maybe in crores also? It can be, it is possible. In fact, by our personal experience, we can say that easily we can have 1 or 2 CR or more than that also, as far as a clinic turnover is concerned. And many doctors are, by the way, doing that right now, but very few are there. So there has to be a protocol, there has to be a system which should be duplicated and replicated to all of you. So when a clinic, in a clinic, when patient enter and when it see that a doctor, an Ayurveda doctor, is also doing uh, like consultation on a digital form. Maybe you can use your laptop, your ipad, or your mobile application. That is so simple, as Dr. Amit also mentioned. But whatever you are using, it should be a digitalized way to doing that, and it give them a sense that okay, their counterparts in other pathies are also doing, and Ayurveda doctor and Ayush doctor are also doing. So it will equivalent, they will judge you in the society. So customer is very smart, client and patient is very smart these days. In all these corporate hospitals you go, and they have the entire software, just they are managing with that now. So that has to be replicated and duplicated to our clinics also. So on this note, I request all of you to get yourself as soon as the software. Now the question is why we should pay if we are getting free. So there are few vendors and there are few players in this industry right now who are offering them free of cost with a hidden agenda, which I must say on this platform today. And I warn all of you, I warn all the doctors, identify that hidden agenda, because it will hamper you in long term. It will impact you. In fact, we are running a campaign of say no to free consultation, and the same players who are offering you software free of cost are running campaigns of free consultation in the social media, just to attract more and more patients to sell their medicines. So we respect all the corporates and all the companies. So let's position yourself as a company and sell medicines directly. We don't have any issue. But on the same note, if you are selling the software and then through that data you want to sell your medicines, which is I don't think so is a good practice. So the simple question to all of you, to all the panelists, and the final question for the day, and please elaborate as maximum as possible as per your experience. And because the end of the day, everybody should work on a viable model. And if we learned about payment gateways, we learned about certain features like secure servers, HIPAA compliance, we learned about lead generation, SMS, email integration. All these things does not come for free in this world. So simple. Let's start maybe in the order of our speakers of the day. So Dr. Abhishek, then maybe we'll go to Murthy and Dr. Amit, and finally Sarath can conclude on this. So why should we pay for a software if we are getting it in free?
Yes, absolutely agree. I just want to say one thing. There is a famous dialogue which says, if you're good at something, don't do it for free. And this is something which I agree with Dr. Piyush Juneja, that if you are good at something, no one is going to give you for free, be it a movie ticket or be it any other show. So as a doctor, you have spent years to get your degree, and obviously you're going to charge for a consultation. Similarly, any other software profession has put in years, has got a degree, and has put in a time to create a software. So unless they're getting something in return, they would not be running the software. And now the question is, if you were to use a software for maybe 5-10 years, and after 5-10 years, if the software shuts down, what about your data? You have all your patient's email ID, you have your patient's phone numbers, all saved on that given software. So will a free software be giving you all your patient's contacts? Obviously, the answer is no. So that's why you need to have the data with you. As I said, that you need to keep your money in a bank which you trust. So initially you will not realize this, but as your practice grows, maybe after a decade, when you have a lot of patients, that's when you realize the importance. Because if you were to see that most of doctors, we put in our time and our efforts to get new patients, but we really do not put in the time to retain patients. As been seen that the amount of time and effort and money a person puts in to get in one new patient, you can actually retain about 10 to 12 patients in the same time. So as I said, that choose a software which you trust, and a software which you know that will be there and you can always get your data. And if you have to migrate from one software to another, that also should be, spoken right in the beginning.
Right. Thank you so much, Dr. Abhishek. And again, thank you so much for joining us today. We are very much motivated and pleased to have you in our session. And we are looking forward to have some more sessions with you on our platform. Thank you so much. Yeah.
Thank you so much, Kirti. Thank you so much for the wonderful
Right.
opportunity,
Murti,
and thank you
your
all.
inputs on this question, that why should we pay for a software? And again, as I have seen all the softwares, in fact, I would like to ask one. In fact, I would like to add one more thing. See, again, I don't know what exactly the people are offering as far as free is concerned. But in the context of software, and prior to going to Murti, because I have used their software, I will be definitely checking and exploring Vedya Manager and softwares from Dr. Sarath as well. So I will be checking that and I will be commenting, and in fact I will be giving my reviews. I will be doing a specific video. I have just thought after this doing this session today that let's have the specific video of each review or each maybe session. So Ayurveda also I will be checking and will be doing that. Maybe I will request Dr. Abhishek also so to check upon other software also, so and share his like feedback on these softwares. So it will help like doctors like us who are using some softwares can share like it's like a auto blogger, auto video blogger, or a food video blogger, or a movie video blogger, just checking other options and sharing the video. I have recently seen a new bike of Royal Enfield Meteor launched yesterday, and there was a nice live session, and like so in that way I purchased my car. So I seen all these video bloggers doing the reviews, and then I finalized the model. So the same way, let's have some video reviews of these softwares so that people and the community can get help. So on the same note, I can say that if you want to drive a Mercedes, if you want to drive an Audi or a BMW, you have to pay a price. So let me request the founder of a software which is equivalent to a Mercedes or a BMW in this industry right now, Murthy. So why we should pay for for your software if we are getting free?
Thanks for that compliment, Dr. Piyush. So, there's a very famous place in New York called Bronx, very notorious. So, you go park your car, somebody is very likely to come and ask you whether you want to pay now or later. So, if you say that, you just ignore him and go inside the building, by the time you come, your tires will be gone and you'll end up paying for that or getting it towed. And otherwise, you pay him, he'll take care of your car, and then, you're secure. So, nothing in the world is free, right? So the reason why people think software is free is because of Facebook, because of Gmail, right? So there are so many apps, WhatsApp. So what we don't realize is if somebody is offering you something for free, then you are the product yourself. They're actually taking you and selling it outside. They're taking the data that you have and they're selling it outside. So what we are not realizing is we are selling ourselves as a product, and somebody is using the data, whether it is Google, Facebook, they're all using a lot of this data and research. A lot of the data gets sold out. There have been a lot of litigations in the US government has been following. In fact, the Indian government has called Facebook because of what they're doing with data. So we have to be careful about where the data is going. I think we've touched this quite a bit in terms of the data security and where the data, who can see the data and all that. So as I said, I mean, there's nothing that is free in the world. So it's a myth that somebody is paying for the software. Somebody is not paying for the software. Absolutely, you're paying yourself, or you're the product in that case.
Great. Thank you so much for this input, Murthy. And quickly, Dr. Amit, what is your take? And you being one of the oldest provider of software, I can see that you have a very minimum cost. It's like negligible. It's the cost of a pizza in India or a movie ticket, but still it is not free. So your input on this question, Dr. Amit. And first of all, thank you again, Murthy, for joining us today. And we appreciate your efforts and your journey to this, and we are looking forward to have some more fruitful sessions in future with you. Thanks for
Sure.
joining
Thanks,
today.
Dr. Piyush.
Dr. Amit, your input on this question?
Yes, Piyush. It's a very crucial and sensitive questions. First of all, see, first of all, when I started my company, it's not for earning the money. I am come to this industry not for earning money, but doing the something good way and just provide a right platform. Even there is no any such an idea, but what I just face any problem for each and every doctors is possible to spend 2 lakhs rupees and just making a software? Not at all. So why just create a just a platform, very nice platform, and that whatever it is we just spend or invest, and that is invest to you just dissemination the cost that the total whole community. The things is that till the date, the simple the objective Ayush making industry digital, we spend the 45 lakh rupees, invest the 45 lakh rupees till date. And even our Vaidya manager cost is, for example, is very minimal cost, 6,000 yearly subscription for the OPD modules and 10,000 for IPD modules. And it's a very, very open cost to our website too. Got it? The things is that, see, nothing is free in this world, because whatever I take the money from any users for like 6,000, even 3,000 we spend the AWS cloud system. Apart from our the regular staff expenditure, developer cost, support system cost, marketing cost, or whatever the office rent cost, there's a cost is for 1 lakh rupees every month. So how is the possible to give the anything is free? It's not possible. But of course, the giving the cost effective, it's definitely the possible. Got it? So this is the things where we just enter in this industry. It's not more like making the any profit like that, but the provide the solution digital platform to the all the Vaidyas what we actually I suffer. The first of all that. And whenever you are just for example, you are taking the free, so what already doctors as ensures or taking the, if the futures in future companies going to shut down, what the happens in your data. So it's a very crucial and sensitive questions, and even our all the privacy policy, everything mentioned during the giving the software, deliver the software, even our website also that. So there is a nothing free in this world is Piyush, because if I am just going to give you like free, so all the data definitely the third the way I just looking for the income or something like that, and that's a wrong practice. What I personally believe. So better you just pay, or that pay is nothing like that. For example, you spend the 500 rupees per month, and if you get the minimum 4 follow-up in a month, not more than that, 4 follow-up in a month, your whole software cost going in 1 follow-up. So this is what we actually, our modules are created in like that, and everybody I like that you just think about that, and whatever it's, please check the company background, what actually they are doing. They are in the e-commerce industry, they are in the purely into the software industry, how many year old they are just giving, they are doing any research. You just use that each and every features, take the trial, and that decide where actually I have to take and which product. What the
Absolutely.
Juneja sir said. Sure.
Absolutely, I
Thank you.
agree with you, Dr. Amit, and I appreciate and we respect and we know that you have invested your sweat and blood in this software along with the money which you have mentioned. And definitely, as correctly said by you and Murthy, there is nothing free. And if you are getting something free, you and your data is the product, and that is paying the cost. And again, you also need to understand, and you also need to be like, see, it's personal choice as well. I can say that yes, I don't want to be mediocre or average, I want to be the best, and for best I need the best tool and the best software. So as I said initially, you want to drive a Mercedes or an Audi, you can choose, and accordingly in the software also you can see that the premium or the best version of the software which you are doing, in which all the features are there. So it's always your choice and how you want to take it forward. And on the same note, I want to now request our final speaker of the day. On the one side, as we mentioned about Murthy, so he being a knowledgeable person as far as the AI is concerned. So maybe again now coming out from the Mercedes and Audi, it's not right now launched in India, but Tesla is one of the leader as far as artificial intelligence is concerned, and maybe we are talking to the future owner of an Ayurveda software, which is similar to a Tesla. So if you want to drive a Tesla right now, you can maybe see this person, and maybe he will be taking that mindset and that aspect in future. So it's your choice, and maybe you want to invest in that way. You can, and you can take it forward. So, Dr. Sarath, what is your take and what is your input on this question? Maybe you will think that we all are maybe it's a very idiotic question. You have invested your whole life and you are coming with a nice product. and we are asking you that why should we pay for your software. But still there are apprehension in this country, which is India, and there are people who are placing this, and there are some hidden agendas as well. And I will respect our community, but still I see many Ayurveda doctors are not that much aware about technologies and softwares, which we will be making them aware, and we will be sharing specific knowledge as well in future. So let's hear from you on this question. And first of all, thank you again, Dr. Amit, for joining us today, and we are very much lucky and privileged to have you on our session. And do join us for future sessions. We will be keeping you posted about our plans, and we want to this is let me just also inform all of you, this is just first introductory webinar of patient management software on our portal. We'll be doing lots of more webinars and more events also in future with all of you, to promote ethical, to promote genuine, to promote really good patient management, clinic management, or entire ecosystem management softwares for our industry, which is required. So, Dr. Sarath, your input and your intake on this particular question.
Sure. Thank you. Once again, thank you. It's a great webinar which you have organized. Again, we are launching the software on November 13th, Ayurveda Day. So I'll give an example, a recent example. I was having a lunch with somebody. My phone was in the bag, the zip, and I put my zip, and it's all locked. And I was having my lunch. And during the discussion, we talked about a product. Okay. So I came back and I opened my phone, and there is an ad of exactly the same product on my phone. So I didn't search. The phone was in my bag. It's locked. So there is, as Mr. Murthy said, there is nothing like free. So they even using your talk time. So why do we have so many devices which can play music, which can go get lights on, lights off, everything, everybody is listening to us and making money on every aspect of our life. Now, if I want to give this software for free, I'll say Ayurveda Foundation, and I'll say, doctors, please take it. And if you wish to donate some money, just like temples, donate it. I would change the name of the company, right? So there is only two things in this life. Either you have a charity or you have a proper business. Now, we can make money in business and go and do charity. We did lots of charity during COVID. We have given away around 60,000 Ayurvedic community kits. But in order to give, I need to make money somewhere. So having good heart is very important. But at the same time, having a financially viable company is also really important. Bill Gates Foundation is there because of Microsoft. If he is giving the Microsoft for free, there is no foundation now, right? So we all have to understand that any company which is financially viable can help us also in future. We saw a lot of banks in India going bankrupt, right? So the same thing is, good, holds good. So let's not use, because software is becoming a foundation for our practice. We cannot build on a weak foundation. Again, that becomes one of the 4 pillars in future. We got to have a software, and let's spend some money. Again, we can always, there's multiple ways to help Vaidyas. For example, maybe, cost can be based on the amount of money they are making, and slowly have a scale model, right? Where a person who just started need not shell down more money. Things like that can be worked out. I mean, that we are really flexible on those aspects, right? But there's nothing like a $0, software.
Great. I think this excellent example which you have concluded, that you were just sitting and you got these ads, and this is the exact thing and exact pain of us as well. That without, in fact, I would like to propose here, in fact, to all those who are offering free, just announce this to your customers to whom you are offering free. That, like the same way Dr. Sarath mentioned, that your data and your customers will be exposed to our advertisement. Will it be fine to you? So I think if it is fine to you, then obviously nobody can stop you. Nobody, we are not forcing you. You can choose your free softwares also, but always remember those free softwares will have the full authority, and the data which you are sharing on those softwares will be exposed to these kind of advertisement and do these kind of free consultation campaigns, or medicines being sold at a throwaway discounts. So this will directly hamper to your practice. So if you are open for this, and if you can digest and absorb that kind of dents to your practice, you can always choose the free aspects, which is fine. However, this particular investment, which I feel on my personal end also, will yield a better return, will give you an ecosystem in which it's not, by the way, just a software is just first step to start a journey in which you can create evidence based Ayurveda. You can create excellent analysis, excellent analytical tools. You have international guidelines and local challenges being addressed. You have your solutions in terms of inventory, uh, GST compliance, stock, accounts management. Many aspects are there when you explore and see the demo. And final word to conclude this session: always select, always, first of all, try. I recommend all of you to do a trial with all these people. We will share their contact details soon in the comment section. Please, and meanwhile you can write us on our email ID. We are quickly sharing our email ID. You can write us. We will happy to connect you directly to all these. So our ID is info@indianvadyas.com. You can write us on this email ID and let us know. And I thank again to all our panelists for joining us today. We are very thankful to all of you for giving time and spending this much of amount of time. And I know you all are very busy. And thank you, Murthy, Dr. Abhishek, Dr. Amit, and Dr. Sarath for joining us today. And we are looking forward to create many more knowledgeable sessions with all of you to educate, to spread this awareness among our audience, our participants, that how we can do justice to our practice in terms of installing in good software for all of us. And it will help us to take Ayurveda to the next level. So, on the same note, have a great weekend. Have a lovely festival week coming up. In advance, happy Ayurveda Day to all of you. Congratulate Dr. Sarath for your launch, for Dr. Amit for being in this industry for so long, for Dr. Abhishek in like providing us this opportunity to have a doctor having a PhD in Ayurveda and having so much of exciting knowledge about Ayurveda, and as well as the software. I have come across very few doctors in this industry who have that much of knowledge as far as the digital aspects are concerned, which you are having. And finally, Murthy for joining us today and coming with the legacy of technology. And I think you have dedicated your entire life now to Ayurveda. And again, congratulate to you also. I think you have also a launch as far as your telemedicine portal is concerned for US and North America patients. So thank you again to all of you, and let's have a continuous journey with each one of you in spreading awareness about softwares which are required for Ayurveda and Ayush industry. Thanks.
Thanks, Dr. Piyush.
Thank you so much, Piyush.